are looking as young as you were always looking.
I don't know what it is. I don't know because, see, I went all the way, as Charmila said, to so many places. And
Are we live now?
Yeah, it's live.
I feel I'm so happy. Am I right, Charmila?
Yes,
Shall
ma'am.
we start, madam?
Yeah,
Shall we
please,
start,
please,
madam?
please, please start. Please.
Good
We are
evening.
live now.
Good evening. We welcome you all for this August evening for the Breast Diseases Saga. Breast Committee Fogsi, along with 5 districts of Tamil Nadu, Theni, Coimbatore, Salem, Dindigul, and Tirunelveli societies. Let's have the prayer song.
நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் மதனமென திகழ்வரத கண்டமிதில் எக்கணமும் அதில் சிறந்த திராவிடனல் திருநாடும் தக்க சிறு திரை நுதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம் வியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Thank you. I invite Fogsi President Shanta Kumari Madam, Secretary General Fogsi Dr. Matri Patel Madam, our Vice President Fogsi Dr. Archana Verma Ma'am, and Dr. Sneha Boya, Chairperson Breast Committee Fogsi. The chief guest of our today's evening is Dr. Jayam Kannan Madam, past Vice President Fogsi. Our guest of honor, Dr. Archana Verma and Dr. Chamila Ayavu, Vice President-elect Fogsi. My co-convener is Dr. Shanti Rani Madam, President, Theni Society. I invite the speakers of this today's evening, Dr. Selva Rani, Infertility Consultant from Dindigul, Chairpersons, Dr. Amala Devi, President, Dindigul OG Society, and Dr. Sheba Rosette Victor, President, Tirunelveli OG Society. The next session speaker is Dr. Vidya Prabhakar, President, OG Society, Salem. The chairpersons are Dr. Chandrakala Maran, HOD and OG, KGPG Institute, Coimbatore, and Dr. Gayatri Nirgal, past Secretary, Tirunelveli Society. I invite the expert for the panel discussion, Dr. T.V. Chitra Ma'am, past President, Coimbatore Society. The panelists are Dr. Manonmani Madam from President, Coimbatore Society, Dr. Nirmala Vijay Kumar, Secretary, Tirunelveli OG Society, Dr. Saravana Kumar, Secretary, Salem OG Society, Dr. Vanitha Rukmani, Secretary, Theni Society, and Dr. Vijaya, Secretary, Dindigul OG Society. May I invite all the dignitaries for the lamp lighting ceremony, please. Thank you. May I invite Dr. Madhuri Patel, Madam. CV, please. Madam has joined.
Yeah, madam is joined. She's there.
Yeah, I'm there.
Yes.
Yeah. Good evening, madam.
Good evening.
Madam
Madam.
Secretary General Fogsi, Associate Editor Jogi, Honorary Clinical Associate, Navros G. Wadia Maternity Hospital, former Professor PGR ESIC Mahatma Gandhi Memorial Hospital, Mumbai, former Associate Professor, Grand Medical College, and Sir SJJ Group of Hospitals, Mumbai, Chennai, Mumbai, India. Welcome you, madam. Kindly share a few words.
Yeah, thank you, Dr.
Yes,
Manju,
yes.
for your kind and generous word. Respected Dr. Shanta Kumari, our most dynamic president. Then, of course, Dr. Jayam Kanan, today's chief guest, and past president, vice president of Foxy. And we had a great time when she was vice president. And today also we have a very good bonding between both of us. And of course, the guest of honor, Dr. Archana Verma, Vice President Foxy, and I cannot say anything about Charmila, who is also guest of honor. I'm so proud to see you, Charmila, everywhere. She's my student from Grand Medical College, and I'm really happy that she's doing very well, and I wish her best luck. And of course, we have Dr. Manjula as a convener, co-convener Dr. Shanti Rani, then Dr. Silva Rani, Dr. Amla Devi, Dr. Sheba, Dr. Vidya Prabhakar, and Sarvana. I had a great time at Salem and I was very happy to be there for the zonal conference. And I have a happy memory of that. Then Dr. Chandrakala, Dr. Gayatri, Dr. Manon Mani, Dr. Nirmala, Dr. TV Chitra, Dr. Vanita, Dr. Vijaya, and all the president and secretaries of Theni, Coimbatore, Salem, Dinkuli, and Tirunelveli societies, and all my universities. Very good evening to all of you. At the outset, I would like to thank all the
hospital initiative.
organizers for giving me this opportunity. And I must say that the Foxy is the most vibrant,
madam
one of the largest.
Gayatri ma'am, please mute
Yeah.
yourself. Gayatri.
Sorry, Abhishek, can you please mute rest when madam is speaking?
Yes,
Yeah.
ma'am.
Thank you.
I must say that the Foxy is most vibrant, prestigious, and one of the largest OBGY professional organization in the world. And we have 260.
Abhishek,
Madhuri
to
madam,
unmute.
please unmute. Madhuri madam, please unmute yourself. Please unmute, madam.
Yes,
Yeah.
Yes, can you
Yes,
hear
ma'am.
me?
Yes,
Yeah.
ma'am.
Yes, yes.
Yes, madam. Yes.
So we all are committed to women's health. Then, as I said, this is a breastfeeding week is happening from 1st August to 7th August, and we are making not only our doctor sensitized, but also our people, mothers, the pregnant ladies, the mothers. We are sensitizing them, and even the family member. They should support the mother for the breastfeeding. And today I had another webinar for the breastfeeding, and where I said we have so many advantages for the baby. There's no infection, cholesterol is very good, and mother can breastfeed the child from the first hour of the delivery, whether it is a C-section or vaginal delivery, and they can continue exclusive breastfeeding for 6 months, and then for 2 years, after 6 months, they can add the supplementary food. And of course, the mother has also many benefits like reduction in the breast cancer, ovarian cancer, endometriosis, hypertension, cardiovascular disease, osteoporosis. So many advantages are there. But I would like to mention one point over here, that when the mother is breastfeeding the child, the bonding is very, very different. So that bonds give, child a very good confidence, and the bonding of mother and child is forever. I will give one example. When I was, I have 2 daughters. My first child, when she was born, I had to immediately join the JJ Group of Hospital as a lecturer. And all that time I was in the hospital. So I feel today also bad that I could not breastfeed for my first child for a long time. But for the second child, I breastfed her almost for 2 years. You know, that time I was quite senior in a JJ hospital, so I could utilize the leave. And my obstetrician, Dr. Sadhna Desai, said, Madhuri, you take whatever leave you have, and you must be with your child. And also the bonding is very good. So I always recommend that, all the children, we want happy future generation. We want to devoid of the, diseases. We want to have a good nutrition which breast milk gives. So it will be very, very, we have to consider that. And I must say today's, all the galaxy of, speakers and chairperson, they are going to enlighten us on the topic, and it will be beneficial to us in day-to-day practice, which will benefit to a woman. I congratulate Sneha Buer. She is an excellent committee chair. She has been doing, once in a, week, all the program, whether it is a breastfeeding week or not. But she is really committed to her committee, and she has done so many webinars and so many conferences. Sneha, I wish you best luck, and at the same time, I appreciate and congratulate you, and I wish you best for your future endeavors. And at the end, I would also wish best to the organizer and congratulate them for the most apt webinar. And at the end, I would like to quote Nelson Mandela, that education is the best weapon when used can change the world. So dear friends, let us use in updating our, knowledge, and give the best to a woman, and give a healthy child to the mother, family, community, and the nation. Thank you once again for giving me this opportunity.
Thank you,
Thank
madam.
you so much.
Thank you so much, madam.
Madam, good evening, Madam Shanta, Madam. Manjula, Madam
Yes,
has
madam.
joined, so we can invite.
Shanta, madam, CV, please. Good
No
evening,
need.
madam.
Good evening. There's no need for CV.
We welcome President of Fogsi to
Thank you.
joining the breast committee webinar today in the August evening. Madam is a senior consultant of OBG and laparoscopic
Thank you,
surgeon
Manjula.
from Hyderabad, President Foxy, chairperson.
Yeah, thank you.
Foxy,
Manjula,
madam. Yes, madam.
Yes.
I think that's
So
enough.
now
Thank you
you are-
very much.
Yes.
Yeah.
We would like to listen to you. Listen to you, Madam.
I don't know. This whole week, I think we have to, hello everyone. I think we have to go on. We are talking about all the importance of breastfeeding and breast committee and all. But I don't think we should be talking about it for a week. It should be a way of life. Unfortunately, we are talking of promoting something which has to be a very natural and a normal process in life. So I think our responsibility is to make this awareness among public, women and general public, the importance of breastfeeding in the society for the next generation. So I think the breast committee is doing a good job, and all of us have to work towards making this and a responsibility of everyone. It is not the responsibility of gynecologists. It's a responsibility of everyone, this whole society. And that's why now with the data in the country, which is showing that the first, not only in the country, world over, we find that those who are starting the immediate breastfeeding within 1 hour is extremely less. So we have to see that we encourage breastfeeding for the babies immediately in the as early as possible, because we know the advantage of the best to everyone. And regards to all the societies of South who have joined this seminar, and Madhuri and Sneha and everyone, Manjula. So thank you and wish you all the best for this webinar. And yeah, thank you.
Thank you. Thank you so much, Madam, for joining.
Thank you, madam.
Thank you for your precious work.
Thank
Can I
you.
have this? Can I have the CV of Dr. Archana Verma, madam?
Jayam Kannan, madam, first, please.
James and Madam CV, please. We welcome you, ma'am. Madam is Foxy Adolescent Health Committee 2013-2015 Best Committee Award Emeritus Professor, Tamil Nadu MGR Medical University, Managing Trustee, Garbharakshi Group of Institution, Director, GFC Fertility Center, Trichy and Chennai. Madam was Vice President, Fogsi, 2018. Madam is the President, Free Legal Aid Center for Women in Trichy since 1992, PMNCH WHO since 2008. She is a course director, certificate course in reproductive medicine, Fogsi, since 2012. Her major achievements are President of India Medal for Outstanding Performance in MBBS, State First in MBBS, University First in MD, Best Paper Award 4 times, Best Book and Medicine Award 2 times from Government of Tamil Nadu, Durusha S.N. Pandit Award, Fogsi Community Work, Best Committee Chairperson Awards. Lifetime achievements are awards are IMA.
Thank you, Manju. Thank you.
And finally, Madam was awarded the RCOG Distinguished Award Service Medal in 2008. Madam is the first Indian to receive such an award, and we are very honored to have you here with us, Madam. Welcome you, ma'am.
Thank you. Thank you, respected Fogsi President Shanta Kumari Madam, and my dear great friend for decades, Professor Madhuri Patel, Secretary General Fogsi. I am really loving to see both Shanta Kumari and Madhuri, whom I know for the past 2 decades. And my dear Sneha, with whom I am connected for the past more than 6-7 years. We have been meeting her very often. The last 3 years, she has been very close to us. And my dear Archana Verma, I will again bless you if you have a meeting on Friday, on Varalakshmi Puja day with my puja. Next time when I go in November, December to Sabarimala, I will tell you, wherever you have a meeting, call me. I will again bless you from the hills of Sabari. Okay. And my dear Charmila, who has worked with me in all thorns of the life of my career as an academician, as a Fogsian, and she will work with me also. I am very hopeful. And to all the presidents of the South societies, starting from Teni, Coimbatore, Salem, Dindikkal, everybody, I'm so happy to see all of you youngsters who are blooming with joy and happy to talk to me in spite of the fact I am a very senior person. And this topic of breast has made everybody feel breast is not an ornament. Breast is an instrument. It is instrumental in making the bonding between the child and the mother. In spite of the fact that breast is being focused so much in all the social medias and even visual medias, once somebody sees somebody is breastfeeding, I don't think that we like to go and have a dare look at them. And the newborn baby, which is the one which is a great soul next to God, has got only 3 things in life. What it requires some warmth, which is given by her hand, and a mouth full of milk, which is given only by a breastfeed. Any nipple feed cannot give the breast, the mouth full of milk. And the third thing is, the child always stops crying when it hears the mother's voice. So the presence of the mother, which will always be great, especially when she is feeding the child, is the one which is making this breast to be taken as an organ in body. Lippincott has said, ovary, corpus luteum is considered as an organ, but ovary is not considered as a separate organ. Breast is also not considered as a separate organ. But because of the special bonding between the mother and child, it has been quoted by many people, take breast as a separate organ. And whenever we see a woman who is having a child in her lap, it's better that nobody asks her, are you breastfeeding the baby? That question is always put into some sort of a disturbance for these people. So that question, we should tell the people, public, not to they should talk about. With all our dress code, which is converting itself from the sari to the 2 pieces, 3 pieces dresses. Can we think of something to gift a woman who has delivered? Yes, give her a breast cover. Gift a baby, this is mother who has delivered. When you go and see her, gift her with a feeding cap, which is required because she is having only 2-piece dresses at home. So she would love to have a feeding cap. I think this majority of the South Indians may not accept. Probably in the West it may be there. But as South Indian nowadays, new girls who are feeding the breast are only in 2-piece dresses. So kindly think of this one. And also when you want to gift, don't give all these Horlicks, all these fruits and other things. Go and give them these wipes. There's cheek wipes which are made of this lactocalamine aloe vera. We have it for our face, The same thing you give it to a woman who has gone with a good, precious delivery. These are things which we should teach to the public. We should, even in our hospital setup, we always give for a newborn baby a towel, a baby dress, all those things. But I think the upcoming doctors should insist on the feeding tops and the cheek covers, wipes and other things. This breast committee has been a committee which was not so much in existence about 15 years ago. But Kavita Pabat took over and made a big conference on only breast. And she had 3 days conference, which is being succeeded by Sneha Bayor, who every day in any conference, she joins. Whether it is recurrent pregnancy loss, cancer conference, cancer, of course, breast has got an importance, but anything, she will put herself into that place and she will see that her topic of breast gets into that place. So from the breastfeeding to cosmetic gynecology to cancer, everything, Sneha Bayur is making herself present. Her topic of committee is made felt present. So in that way, to Shantakumari madam, who said that every day Sneha Bayur is coming for some sort of a meeting or anything, I'm happy. And 1 week she is focusing on this committee meeting. I say 365 days is her committee meeting. And this is like a Brahmotsavam in any temple. Every day the temple is open and we go and offer prayers. Whereas once in a year, there is what is called a Brahmotsavam. That is 7 days, 10 days, special puja is being done. So I think Sneha Bayur is making the special puja day of the breast committee here. And in this special puja day, I'm very happy to see dear Manju. Initially, she was sitting so tight, like sitting on a, what I say, over a peak. But now she is riding a horse. Now she is really smiling. When Shantakumari madam came, I should see her face. She was so dark and she was scared. But I think Sneha Bayur has given her a nice platform and she is going to make it very nice. Shanti Rani, not to say anything about her, she has been adept. And all these presidents and secretaries who are sitting here are eligible to become some sort of a post occupier in Fogsi, be it a committee chair or be it a committee member. I wish all of you great life ahead, and all your patients should feed the sick child within first year, 1 hour. Please do not shift the patient from the labor room to her room because she is very eager to go to the room and see everybody. Tell her, only if you breastfeed, I will shift you to the room. So that becomes a trump card based on which she will be shifted. So we insist, tell her in the antenatal period itself, the postnatal period will be made easy. Good luck to all of you. Waiting to hear from you all more about breast. Thank you.
Thank you, madam. Thank you so much. Can I have the next CV of Dr. Archana Verma, madam, please? Our guest of honor, Dr. Archana Verma, madam. She's Vice President Fogsi and Associate Member of RCOG. Founder President, West UP Chapter, Organizing Chairperson UP COG 2020, past President Ghaziabad OG Society, Organizing Secretary North Zone UA Fogsi 2016, and UP ISAR 2015, Organizing Secretary Midterm UPCOG 2015, Chairperson Public Awareness Committee Fogsi 2016 to 18, Member Rotary Lions Ekta, Vidan BVP, faculty in 300 plus national and international CMEs, India Book of Award winner, President Fogsi Best Committee Appreciation Award, UP Governor Uttarakhand Governor Appreciation Award for Menstrual Hygiene, Appreciation Award from CRPF Director for Health Programs 2019, a Women of the Year Health Award from IAS Wives Association.
Thank
Welcome
you.
you, madam. Please
Thank
take,
you. Thank you. Next time I will add one line in my CV also, much blessed by Dr. Jayam Kanan madam, direct from Sabrimila. So, so that will be included in my CV. And thank you very much for the nice introduction. Thank you all our senior and respected Jayam madam for saying all good words for everybody. I think not much is left, and Dr. Shanta Kumari and Dr. Madhuri Patel has also given their words of wisdom, and I really am feeling very proud, and it's my proud privilege also to be here to have a word with you all. So the Thani and the Coimbatore, Salem, Dindigul and Tirunelveli, I think there is some maybe some lack in pronunciation. When I'll come in person, I will just learn the real names and the this how to pronounce them. And Manjula, thank you very much. And Sneha, you are doing wonderful job. And this, I just want to say, as a public awareness person, it is definitely our responsibility. Give time to your, we must tell our mothers that give time to your babies right from your dream days of first day of conception. That is to include it till the 1000 days. So this 1000 days will be must be in your mind. This thing is we have to talk about, we have to do, we have to sleep, and we have to work for the breastfeeding. And because only these 1000 days will bring lot of difference in the child's life later on. And because once the foundation is good, you know, the baby always keep smiling. So you see, they're like Charmila, you know, she must have, I can see her, I can without seeing her mother's photo, I can just imagine how her mother must have brought up her. So that those I mean, you see, all those mothers who have really given time to their kids excel how nicely in the future. And they must understand the value of breastfeeding and must feel lucky to have delivered and have a chance to breastfeed to the mother. It is a natural way of divine connect, you know. Mothers are great only because they are upbringing their childs and taking care of them, and just no need to enumerate what are the benefits from a gynecologist point of view, because this is to be into the mind only. And this good ANC care, and just telling them that this is a way to happiness. And theme 22 of this is breastfeeding is again to educate and support and step up breastfeeding, and let's make all our hospital breastfeeding friendly hospital. And it's a great initiative, and the best way to is to give the incentive to the nursing homes and hospitals and your staff, those who just keep a data, and in any district, anybody who is doing good, they should be given some sort of awards, and from administration also. This is my recommendation, because incentive makes a thing possible very fast and very interesting also. Thank you very much.
Thank you, madam. Thank you so much for joining us. CV of Dr. Chamila members. Our next guest of honor is Dr. Chamila Ayavu, Vice President-elect Fogsi 2024, Chairperson Clinical Research Committee Fogsi 2016 to 18, ICOG Governing Council Member 2021 to 23, National Coordinator UNICEF Fogsi PCA, National Coordinator MEDA Fogsi PG Program, National Coordinator ISAR Gurukul 2022, WHO CRO MDSR India Member, Past Secretary Trichy OG Society, President, Menstrual Hygiene Management Consortium 2018 to 20. She's Joint Secretary, Justosis India Association. It's a great honor to have you here, ma'am.
Thank you. Thank
And
you so
kindly
much.
say a few words and bless us for our program, please.
I cannot bless in a program. I got my teacher, Dr. Madhuri Madam, and my mentor, Dr. Jayam, sitting there. So I would like to actually thank all the presidents and secretaries who joined today. I know it's a very busy day, but you took the time out to attend this program. Thank you so much for that. I'd like to thank my teacher, Dr. Madhuri Madam, for giving those blessings for me actually, and my mentor, Dr. Jayam Madam. You have made me grow so much, and I think that this past 10 to 15 years, which you have groomed me, it makes a very important part of my life. Thank you so much for that, Jayam ma'am. And I'd like to welcome Dr. Archana ma'am. Archana Verma, she always brings a smile to any program. She's so enthusiastic, and that's why I told her also to utilize the services of the great departments of both Coimbatore Society and Teni for her PPH programs, because she's doing such great work throughout the country. Archana, it's a request that you utilize the good inputs from these people always. Thank you so much for joining. I'd like to thank Sneha for the opportunity, and Sneha has been a great friend of mine for past many years. I'd like to wish her the best for whatever she wants to do in life, and we are with her always. That's a promise, Sneha. I'd like to thank the President and Secretary of Teni Society, Dr. Shanti Rani, who's also the convener for this program, along with Manjula. Both have done a great work. Dr. Vanita, who's also a panelist. The Dindukal Society President, as I said, doyen of Tamil Nadu Societies, Dr. Amala Madam. Dr. Vijaya, the Secretary, who's also a panelist for the program. Dr. Sheba Madam from Tirunelveli Society, President, who's always so enthusiastic. And Dr. Nirmala Vijay Kumar, who's also the panelist as well as the Secretary of Tirunelveli Society. Welcome, Vanita. Welcome, Nirmala. And I'd also like to welcome Dr. Vidya, a speaker also. And Vidya has done such great work for South Zone UA Fogsi, and it was one of the best programs for the year. Thank you, Vidya, so much. You give such good hospitality and provided us so much of opportunities. I'd like to thank Dr. Saravana Kumar, the Secretary of Salem Society, who's a panelist also. From Coimbatore Society, Dr. Manon Mani, the President, has joined. Along with her, we have got the speaker, Dr. Selvarani, the expert panelist, Dr. TV Chitra ma'am, who's a great academician. She gives such great inputs. It's an honor to have you as an expert panelist. And also the chairpersons, Dr. Chandrakala, as well as Dr. Gayatri from Teni. Chandra is my classmate from school, and Dr. Gayatri madam from Teni. It's always a pleasure to have you. Like to I'm not going to stand between academics and anything else, and it's always an honor to attend any committee program of Sneha, and I would like to wish her the best again. Thank you so much, Manjula. You've done such great convening. Thank you so much.
Thank you, ma'am.
So much, dear Charmila. Thank you.
Can I have the CV of Dr. Sneha Bhuya, please? Dr. Sneha Bhuya, Madam is Managing Director, Sukata Hospital, laparoscopic surgeon from Yavatmal. She has National Individual Award Fogsi 2008 for outstanding work in rural obstetrics. Dr. Anandibai Joshi Award by Government of Maharashtra 2005. Fogsi President Appreciation Award for Public Awareness 2018. And Fogsi President Appreciation Award for Exemplary Work in Cancer WOW 2019. Champions of Fogsi Award 2019 and 2021. International MS Signature Award for Phenomenal Leadership 2020. Lokmat Healthcare Excellence Award 2020. Asia GCC Award for Leadership in Healthcare 2021. Champions of Fogsi Award. National Expert UNICEF Lead Excellence.
Thank you, Manjula.
Fogsi Manyata.
Yeah, Manjula, thank you so much. You can skip this. You can skip this.
Please say a few words, madam.
Yeah.
Chairperson of Press Committee Fogsi, please.
A very good evening, respected Madam Shantakumari, Madam Madhuri Patel, our Vice President in charge Press Committee, Dr. Archana Verma, respected Madam Jayam Kanan, my dear friend and guest of honor for today's program, Dr. Charmila, our coordinators, Dr. Manjula Appadurai and Dr. Shantirani, who have done great job for coordinating this program, and all the respected, esteemed faculties, presidents and secretaries of all the societies of Trichy, Theni and Tirunavelli and two, three more societies. I will just say to make it short, all the societies, president, secretaries, all the respected faculties. I'm very happy to have you here and thankful for organizing such a wonderful academic event. Definitely looking forward for all your inputs. I'm going to have a panel discussion, so I would not spend much time and stand between you and the academics. I will just say that, yes, as Madam Shantakumari has said, breastfeeding is a natural instinct, though it is a complex process mediated through neurohumoral reflex. It is controlled by emotions. And India being such a emotional country, I would say, in spite of we having such close bonds in the families, we are still lagging behind like the rest of the world in breastfeeding. And the figure says it's only 41% till date. Even today, the breastfeeding within first 1 hour of life and the exclusive breastfeeding for first 6 months and the continuation of breastfeeding for 2 years and beyond with complementary feed for 6 months onwards. It is shamefully low, I would say. And that's the very reason for last 4 years as committee chairperson, along with my committee, we are working on breastfeeding promotion. We are working on 3 aspects, but today I will speak only about breastfeeding. For this, we are sensitizing the Fogsians, we are training the paramedics, and we are making awareness in the general public. And I'm so happy that last year, of the 266 societies in the history of Fogsi, I would say Madam Shantakumari has made this statement in the last managing committee meeting, that of the 266 societies, 250 societies participated in the program. And for that, I'm so happy that the Fogsians, we are successful to sensitize and make you all aware, and you all are contributing to this noble cause. So I think well begun is half done, and I hope that we are very close to the SDG goal of achieving 100% breastfeeding with all your support. And once we join hands together, we can definitely make it. With this, I end my few words and thank you, organizers, and I hand over the mic to you, Manjula, once again.
Thank you.
Thank you so much.
Thank you, ma'am. Thank you so much. Let's move on to the scientific session. May I request Dr. Shantirani, Madam, President, OG Society, to further proceed.
Thank you, Manjula ma'am. A very good evening to all. At the outset, I like to thank Sneha ma'am and Charmila ma'am for giving me this opportunity to be the co-convener. And I take this opportunity to thank the President and Secretary of Fogsi for their gracious presence in spite of their busy schedule. And my respect to Jayam Kannan Madam, who is always a constant encouragement for us, from a very smaller societies. And my respect to Archana Verma ma'am, who is for their presence today. With that, we are moving into the scientific session today. The topic one is breastfeeding, the elixir of life. We are having the speaker, Dr. Selvarani, infertility consultant of Dindikal. And we are having 2 chairpersons, Dr. Amala Devi Madam, President, Dindikal OBGYN Society, and Rishiba Victor from President, Tirunelveli OBGYN Society. Can I have the CV of Amala Madam? Yes. There is no need for any introduction for Amala ma'am, but still she had her MBBS from Tirunelveli Medical College, MD DGO from Madurai, and she is retired from Tamil Nadu Medical Services as a project officer and joint director. And she was the director of family welfare and founder secretary of Dindikal OBGYN Society 2004. And at present, she is the president of Dindikal Society. She is the IMA secretary from 2010 to 12, and then president of Dindikal Managara Tamil Sangam, chairperson of Women Doctor Wing IMA Dindikal at present, and she is a EC member of TNFOG. And the present time, she is the president of Dindigul Cosmos Lions Club. I welcome you, madam. I like you to. The next person is Dr. Sheba. She is the professor of Department of OBGYN, Tirunelveli Medical College, and she did her MBBS in Madurai and MD in Tirunelveli Medical College. She is present time president of OBGYN Society, Tirunelveli. She was awarded with Best Doctor Award of State 2018. 22 years of teaching experience she is having, and she had organized various conferences in India. I welcome you, Amala Madam and Sheba Madam, for this program, and I now invite Sheba Madam to introduce Dr. Selvarani. Sheba Madam is there.
Thank you, Shanti Rani Madam, for that kind words.
Okay. Now, the present speaker of today is Dr. Selvarani. She is the Chief Consultant OBGYN Infertility of
Shanti, Sheba Madam has joined actually. She's there.
Joined. Okay.
She's there.
Madam Sheba
Yes,
Madam.
Yes, madam. Yes, madam.
I am, madam. Please introduce Dr. Selvarani, ma'am. Today's
Yes,
speaker,
madam.
madam. Okay.
So thank you, Shanti Rani Madam, for those kind words. Now, the first speaker, Dr. Selvarani Jayaraman. She is the Chief Consultant, OBG Infertility, and she is a former Medical Superintendent of St. Joseph Hospital and Sri Amogam Hospital, Dindigul. She has presented many papers and posters in district and national forums. And her special interest is in infertility and high-risk obstetrics. And she has done her post-graduation from Rajamutiya Medical College. And she has done a lot of courses after that, including a course in diabetology, sonology, laparoscopy. And she has underwent postdoctoral fellowship in reproductive medicine, diploma in reproductive medicine. And she is an enthusiastic young practitioner. Welcome you, ma'am. Now I hand over the forum to Dr. Selvarani, madam. Please, madam.
Thank you, ma'am, for introducing me. And good evening, dear legendaries in front of me and dear senior madams. I'm very much thankful for inviting me as a speaker today in this great forum. Thank you so much for this opportunity. And this breastfeeding is a lifeline for a lifetime. So it is not about my right to breastfeed. It's about my child's right to eat. We have options in everything in our field, from when to conceive, mode of conception, mode of deliveries, cafeteria approach in sterilizations, etc. But as far as baby is concerned, there is no other option than breast milk. As we say, breast milk is the best milk. It is far more superior than any other energy drinks. As we are celebrating the breastfeeding week from 1st August to 7th August, this webinar is appropriate for discussion in this time. And let us move to this topic now. Breastfeeding as a lifeline for lifetime. Dr. Abhishek, can you share the slides, please? Breastfeeding, the breast milk is a mother's gift to her child, herself, and the nation. When quote from a pediatrician, Dr. Bo Walvis, 1981.
Can the host change the slides for her? I think the slides are not changing. Yes. Dr. Selvarani, you have to tell them to change, otherwise they won't change.
Yes, ma'am. Change, sir.
Next slide, please, Abhishek. Yes.
So by Dr. Bo Wallis, pediatrician, in all mammalian species, the reproductive cycle comprises of both of pregnancy and breastfeeding. In the absence of later, none of these species, man was included, could have survived. By the breastfeeding and overview of WHO 2021, breastfeeding is one of the most effective ways to ensure child health and the survival. About nearly 2 out of 3 infants are not exclusively breastfed for the recommended 6 months, still a rate that has not improved in 2 decades. This breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help protect against many common childhood illness. Next slide. The breast milk provides all the energy and nutrients that the infant needs for the first month of life, and it continues to provide up to half or more of a child's nutritional needs during the second half of the first year, and up to 1/3 during the second year of life. The breastfed children perform better on intelligence tests, or less likely to be overweight or obese, and less prone to diabetes later in life. Women who breastfeed also have a reduced risk of breast and ovarian cancers. Inappropriate marketing of breast milk substitutes continues to undermine efforts to improve breastfeeding rates and duration worldwide. So these are the benefits of breastfeeding. Who have breastfeeding the child of lower risk of asthma, obesity, type 1 diabetes, and severe lower respiratory diseases, and even the ear infections, and sudden infant death syndrome, gastrointestinal infections like diarrhea, vomiting, NEC for preterm infants. Benefits to mothers, like mothers who breastfeed their infants have a lower risk of breast cancers, ovarian cancers, and type 2 diabetes, as well as the high blood pressure. The data of Lancet also highlights children who are breastfed for longer periods shows a lower infectious morbidity and mortality, and they do have very fewer dental malocclusions, and they will have a higher intelligence rate and might protect against overweight and diabetes later in life. Breastfeeding benefits to mothers, said like before, the breast prevents the breast cancer as well as from the ovarian cancer, and improves the childbirth phasing. These are the main bioactive molecules present in human breast milk and their benefits. When we take consider these of this, only the casein, which is 3.6 milligram per ml, which acts the anti-inflammatory role in mucosal protection. The second is the lactalbumin, which acts against the antimicrobial action and plays in the immune system modulation. And the amino acids, they also have the antimicrobial action, microbial homeostasis, immune system modulation, and others like the mucin, lactate, herin, others. So this breast milk biomass, next. These breast milk act as a bioactive molecules via the infant's body, which protects the infant's body from respiratory and gastrointestinal diseases, protects from the immune system modulations, act as a mucosal barrier maintenance, and maintains the microbiome homeostasis, and there will be the low incidence of infections. Globally, 3 in 5 babies are not breastfed in the first hour of life. It's true. 3 in 5 is not breastfed. If we see the global distribution of breastfeeding at 12 months, these data are from 153 countries between 1995 and 2013. Globally, the prevalence of breastfeeding at 12 months is highest in Sub-Saharan Africa, South Asia, and parts of Latin America. In most high-income countries, the prevalence is less than 20%. If we categorize the breastfeeding indicators by country income group, let us differentiate from low income category, low middle income, upper middle income, high income, where all the income-wise categories also, early initiation was low in all settings, as was exclusive breastfeeding also. Breastfeeding at 12 months was widespread in low income, and lower middle income settings, but uncommon elsewhere. This is a conceptual model of components of an enabling environment for breastfeeding, how to promote the breastfeeding, model of these are the determinants like structurally how like a socio-cultural market context by through integrated mass media or social mobilization, or by the setting systems like health systems and services, or by the family and community, workplace and employment like legislation, policy like maternal leave policies, financing, monitoring, and enforcement. By individually, mothers and infant attributes like mother-infant relationship, there also do the counseling, support, and lactation management plays a role. So where all this conceptual model initiates the early initiation of breastfeeding and very exclusive breastfeeding at least for 6 months of time, and still it can be promoted to 2 years of life. Next slide. So this individual counseling or group education, immediate breastfeeding supported delivery, that is immediately after 1 hour of life, and lactation management increased exclusive breastfeeding by 49% and any breastfeeding by 66%. This combined health systems and community interventions increased exclusive breastfeeding by 2.5 times. So when the breastfeeding in the USA and UK, in USA, rates of breastfeeding, although low, or increasing in both countries, USA achieving greater gains. Breastfeeding targets and actions to improve breastfeeding, such as peer and professional support, and implementation of the baby-friendly hospital initiative reported by the CDC. Breastfeeding in public is protected through legislation in nearly all states. UK provides a full year of paid maternity leave. Many maternity services have baby-friendly accreditation. Even they have legislation protecting breastfeeding in publics. These are case studies from a low-income and middle-income countries like Bangladesh and Nigeria. In past 6 to 8 years, this exclusive breastfeeding has increased in both countries. Percentage point also increased in Bangladesh is double that of Nigeria, 13% versus 6%. Implementation of the breastfeeding hospital initiative slowed because of shortage of funding in Nigeria. We take Brazil and China between 1996 and 2006, any breastfeeding at 12 months in Brazil had a point increase of 15%, whereas between 2003 to 2008, a 5% decrease occurred in China. A certification and a recertification of hospitals is baby-friendly to maintain quality standards. It's extensive in Brazil. Breastfeeding promotion in China is any challenges, enormous population because they have large number of maternal facilities. And this breastfeeding hospital initiative is actively implemented by the Ministry of Health and Family Welfare. In now our situation in India, 41.6% of newborns were put to breastfeed within 1 hour of birth. We did not even achieve 50%. Only 50% children are exclusively breastfed for the first 6 months. The WHO and the UNICEF launched the breastfeeding hospital initiative in 1992, integrated management of childhood illness in mid-1990s, and IYCF in 2002. All these programs have been adopted by India since the last 1 to 2 decades to promote appropriate feeding practices in children under 5 years of age group. Prevalence and social acceptance of breastfeeding vary from region to region. Whereas in India, Maternity Benefit, the Amendment Act 2017, so they increased the duration of maternity leave from 12 weeks to 26 weeks, but now increased furthermore till 365 days. for surviving with 2 children. In cases where a woman has more than 2 children, leave is limited to 12 weeks, 1 week. So these are some government steps taken by our Indian government to ensure infant and the young child feeding programs like Poshan Abhiyan and the Mother's Milk Best India's best startup breastfeeding. These are some of the things that can be seen through the public from the government forums. Next slide. The WHO and the UNICEF recommendations. The WHO actively promotes breastfeeding as the best source of nourishment for infants and young children, and is working to increase the rate of exclusive breastfeeding for the first 6 months up to at least 50% by 2025. The WHO and the UNICEF recommend that children initiate breastfeeding within the first hour of birth and be exclusively breastfed for the first 6 months of life, meaning no other foods or liquids are provided, including water. Infants should be breastfed on demand. That is, as often as the child wants, day and night. There should not be no bottles, teats, or pacifiers should be used. From the age of 6 months, children should begin eating safe and adequate complementary foods while continuing to breastfeed for up to 2 years and beyond. Next slide. Here are some steps, 10 steps to successful breastfeeding. There may be a hospital policies where the hospital supports mothers to breastfeed by not promoting infant formula, bottle feeds or teats, making breastfeeding stand practice, and keeping track of support for breastfeeding from the hospital policies. And by the staff competency, hospitals support mothers to breastfeed by training staff and on supporting mothers to breastfeed, and they can assessing health workers' knowledge and skills, and through from the antenatal care, hospitals support mothers to breastfeed by we can teach some programs, and there are care right after birth. Immediately we can, even as Madam said, immediately, even if it is a normal delivery or a cesarean section, if the baby is put on mother's skin to skin within 1 hour of life, it will be very benefit to the mother as well as the baby. And like support mothers with breastfeeding, one can be with her like a moral supporting and supplementing some healthy foods to mother also during lactation, and rooming in with support like her mother, or they can make a triangle that the triangle should be always with the baby and the mother. The next, and the responsive feeding, like helping mothers know when their baby is hungry and not limiting breastfeeding times. Whenever the baby demands, she can give the breastfeeding, and do not support with bottles, teats, and pacifiers. Counsel the mothers on the use and risk of feeding bottles, teats, and other pacifiers. And during even the discharge, hospitals support mothers to breastfeed by referring mothers to community resources for breastfeeding support, working with community health workers to improve breastfeeding support services. WHO 2018 Counseling of Women to Improve Breastfeeding Practices. Counseling should be provided to all pregnant women and mothers with young children. Counseling should be provided in both the antenatal period and postnatal period and up to 24 months or longer. Counseling should be provided at least 6 times and additionally as needed. Counseling should be provided through face-to-face counseling. and may in addition be provided through telephone or other remote modes of counseling. Counseling should anticipate and address important challenges and contexts for breastfeeding, in addition to establishing skills, competencies, and confidence among mothers. The infant, next slide. The infant and young child feeding guidelines like breastfeeding should be prompted as the gold standard feeding option. Whenever the antenatal counseling individually or in groups organized by maternity facility or mother support group should prepare expectant mothers for successful breastfeeding. For all normal newborns, skin-to-skin contact should be initiated in about 5 minutes of birth in order that baby initiates breastfeeding in an hour of birth. Breast crawl can be adopted for early initiation. In case of operative birth, the mother may need extra motivation and support. Skin-to-skin contact between the mother and newborn should be encouraged by bedding in the mother and baby pair. Mother should communicate, look into the eyes, touch, and caress the baby while feeding. The newborn should be kept warm by promoting kangaroo mother care. The baby should be fed on cues whenever necessary. Crying is a late cue and may interfere with successful feeding. And baby should be breastfed at least 8 to 10 times in 24 hours till lactation is established. That is 1 to 2 weeks in time, indicated by frequent urination, stooling, and adequate weight gain. A sleepy baby can be easily woken up by removing blankets, removing clothes, changing loin cloth if wet, skin-to-skin contact in kangaroo position, and gently massaging the back and the limbs. The periodic feeding is practiced in certain situations, like in the case of a very small infant who is likely to become hypoglycemic unless fed regularly, or an infant who does not demand milk in initial few days. The adequacy of breastfeeding in this critical period should be monitored by clinical parameters complemented by weighing on digital weighing scale. Minimum sensitivity of 5 grams on day 1, day 4, day 7, and day 14, last day 28. These are the key aspects for establishing an adequate breast milk supply. From the sufficient mammary tissue may cause normal hormonal levels and effective and regular removal of milk. This causes insufficient. What are the insufficient mammary tissues? Like some mothers they have the hypoplastic breast, only the breast tissues will be very minimal, and they have undergone some breast surgeries or breast removal. Like the maternal factors that influence hormonal levels, like when they do have retained placenta or they suffer from severe postpartum hemorrhage or hypothyroidism and they are not a regular of their drugs, and a set of stress, anxiety, and even obesity may take a factor, and regular effective removal of milk influenced by a method and frequency of expressing the milk, inability for infants to effectively remove milk from the breast, proper sucking, poor attachments between the mother and the baby, low infant intraoral vacuums or infant any medical problems, etc. So there are proper ways of breastfeeding. There are some list of principles of positioning the baby. So the first is the mother should be in a relaxed and comfortable position that does not cause any pain to mother. Example, even from an episiotomy or a cesarean birth. The second is when the mother and infant are well supported. Supports may be used to help a mother find a comfortable position while breastfeeding is very important. Otherwise, they do complain of giving a spinal anesthesia till their lifetime. They would be complaining of back pain because of the spinal anesthesia with a small needle. So the position plays is very main role. and the mother holds her infant unswervingly tucked in close tummy to mommy, with shoulders and hips aligned and well supported. An infant is well aligned if an imaginary line can be drawn from the infant's ear to shoulder to head. The infant's head and neck are slightly extended, which means slightly tilted back, sometimes called a sniffing position. During latching, the infant's head is slightly extended with the lower lip or chin touching the breast. This will allow for a deep latch. And we have to teach the mother to pay attention to the amount of areola in her infant's mouth, not only the nipple, but there must be some areola tissue also should be inside the mouth. Sometimes the natural relaxation that happens with feeding leads to the areola slipping out. Encourage the mother to notice any tension in her shoulders and then relax them. There is a strong interaction between head and neck position and feeding function. And there is a head and body alignment work together to achieve a position that enables breast milk transfer. These are the techniques of breastfeeding. Here the baby, hold your baby towards your body and the body's nose as close to your nipple. The second is move your baby back an inch or two. The baby's head should tilt back and her mouth will open. It's important for your baby's mouth to open wide when she's start breastfeeding. And if the baby does not open its mouth, you can touch your nipple to the baby's lips to get the baby to open up. When she opens her mouth wide, move it onto the nipple by pulling the baby toward you. This is called latching on. Get as much of your areola into the baby's mouth as possible. And watch to see if your baby is sucking and swallowing easily. We can even listen the sounds of a happy feeding baby. Next. These are the signs of correct latch on. The baby's full mouth should surround the tip of the nipple and about 1 inch of the areola. The lips should be turned outward against the breast. The motion of the suck is along the jaw, not in the cheeks. It's very clear in this picture. And this latch acronym says L for lips clanked out wide, gapping mouth to accommodate areola nipple. A for asymmetric latch. There is more areola visible above the baby's top lip. Tummy to mommy, baby's ears, shoulders and hips in alignment. And C for the chin touching breast, nose free in the sniffing position. And H, have a listen and watch. That active suckling and swallowing indicating milk transfer to the baby. These are the different types of holding techniques. The first is the cradle hold. This is a cross cradle, or the next is the clutch or football hold. And even we have the side lying position, but we must be very careful when the mother is on the lying position. Sometimes the baby may aspirate the mother's milk. And the next is the Australian hold breastfeeding techniques. Taking baby off the breast after breastfeeding. Do not immediately remove the breast from the baby's mouth. Break the suction by slipping the little finger in the corner of the baby's mouth between her and the gums. Don't remove the baby from the breast until the suction is released, or sore nipples may result. The suction is usually quite strong. So these are the signs of effective breastfeeding, like when we give a frequent feedings of 8 to 12 times daily, Intermittent episodes of rhythmic suckling with audible swallows, that is happy suckling, should be heard while the infant is nursing. Infant should have about 6 to 8 wet diapers in a 24-hour period once breastfeeding is established. Infant should have minimum of 3 to 4 bowel movements every 24 hours. Stool should be soft and yellow after day 3. An average daily weight gain should be of 15 to 30 grams. An infant has regained birth weight by 10th day of life. There are some problems in women during breastfeeding according to the age of baby, like age from 0 to 1 month, and the age of 1 to 3 months, from age of 3 to 6 months. It depends upon the categories of problems like physical and technical aspects, and even to the psychological aspects. Even a sore nipple, they do tell from even from 0 months to 6 months. And from the age of 0 to 6 months, the mother will be sick because of some pain from the episiotomy or the cesarean side. And there will be less milk production because there may be a primary mother, they do not have much awareness of about breastfeeding, and babies are from express neonatum and cesarean sections, and even mothers do not express their breast milk. They do have breast engorgements, and even the fuzzy baby on demand feeds, nipple infections, sick baby not roaming in properly, flattered inverted nipple, improper breastfeeding, and position challenges, latching difficulties. There must be, till this infant refusal to breastfeed, till they will have 6 months of this physical and technical aspects. Mother do complaints whenever they land up to our clinics, because they complain that the baby is not feeding properly, and the baby is very fussy, and whenever I try to give mother's milk and baby is not taking properly. So that's what we initiate this breast feeding, breast milk and breastfeeding awareness during the antenatal and the postnatal mothers, and through our nursing health workers. And also, like psychological aspects, they are getting tired. Somebody may be the working mother because of tired and more pressures, and there may be a low milk supply even from the 0 month to 6 months of breastfeeding process. Uh, in globally, the suboptimal breastfeeding, as many as 1.4 million lives are lost due to suboptimal breastfeeding in the developing countries. Offsetting deaths caused by mother to child transmission of HIV through breastfeeding could be as high as 242,000 if relevant WHO recommendations are not followed. And there is a attributable fractions for deaths due to diarrheal diseases and respiratory tract infections, or 55% and 53% respectively for the first 6 months of infancy, and 20% and 18% for the second 6 months, and or 20% for all cause deaths in the second year of life. What we have can take the key messages here is the children who are breastfed for longer periods, they do have the lower infectious morbidity and mortality. They have a fewer dental malocclusions, higher intelligence than do those who are breastfed for shorter periods or not breastfed. Breastfeeding might protect against overweight, diabetes later in life. Breastfeeding benefits mothers, like it can prevent breast cancers, ovarian cancers, and improve the birth pacing, and might reduce women's risk of diabetes. High-income countries have shorter breastfeeding duration than do low-income and middle-income countries. However, even in low-income and middle-income countries, only 37% of infants younger than 6 months are breastfed. So, breastfeeding is the scaling of breastfeeding can prevent an estimated 823,000 child deaths and 20,000 breast cancer deaths every year. findings from studies done with modern biological techniques suggest novel mechanisms that categorize breast milk as a personalized medicine for infants. That is not a medicine, it is a mother's wish. So it is a God gift. The breastfeeding promotion is important in both rich and poor countries alike and might contribute to achievement of the forthcoming sustainable developmental goals. Thank you very much for the patient listening. Thank you very much for all the legends.
Thank you, madam.
Thank you very much, Amla ma'am.
Thank you, madam. Such an elaborative talk. We started with the statistics, government policies, hospital friendly, baby friendly hospital initiatives, and guidelines and position and everything you have covered. Now, may I request Amala madam to share her thoughts and conclude the session. Amala madam, unmute. Please unmute, madam. Amala madam.
Yes, am I audible?
Yeah, madam.
Thank you so much for the entire team, including the President Fogsi and the General Secretary and all the press committee chairperson and Dr. Jayam Kannan, Dr. Charmila, everybody, all society presidents and secretaries of the South districts, Nagarkovil, Tirunelveli, Theni, Salem, Coimbatore and all. எனக்கு ரெண்டு கேள்விதான். One question is that ஆடு மாடுலாம் குட்டி போட்டா நம்ம யாரும் போய் நீ பால் கொடுன்னு சொல்றதே இல்லை. Why this happen? Because in the earlier days, some 50 years or some 4 to 5 decades ago, all the village women, as soon as the child is born, there is no other alternative for them to give. This is the only food already made by God in the mother's breast to feed the child, to quench his thirst, actually. So they were nutritious. The bonding was nice. All people were healthy, even though there was neonatal mortality and all. People who are living were healthy. They never left the mothers or the fathers in the homes. But nowadays, what happens is that they want to have some alternative. Women are educated, going for job, earning good, and they are having variety of jobs in the society available for them. Some people are becoming artists, some people are becoming executives. So they have got a false hope that their beauty will go off if they feed the children. Because there will be some sagging, there will be some amount of sagging or looseness of their breast. So for this only, this World Breastfeeding Week was initiated. 107 countries are following this 1 week they are following. Actually, it is to protect and promote and support breastfeeding, says WHO, because these breastfeed children are more intellectual and they are fit. It is not a social stigma. Nobody will trust you or force you to give breast milk. But as Dr. Selvarani had given an elaborate talk, while she was talking, I was thinking that getting the matter from her, better I will book a small booklet for the women in regional language, so that we can give to our women, antenatal mothers who are coming. And then the second question for me is that, and one thing I just want to tell you, that the pediatrician used to say the cow's milk we are giving in villages for the children are not prepared for the child. It is weighing around 3 kg, but the calf is around 20 kg or 25 kg. So when a bottle food or any, even for Horlicks, they will put for juniors, it is junior Horlicks, and for adults, it is a big bottles. So that cow's milk, the components of the cow milk does not suit a small child. So sometimes they are getting all sorts of infection. by taking the mother's milk, as already Dr. Selvarani has narrated. There are so many benefits for the child as well as for the mother. There is not only the bonding between the mother and the child is more when she gives her milk. Actually, it's not a milk. Actually, they used to say that it is the blood which she is giving to her child. உதரத்தை பாலாக்கின்னு சொல்லுவாங்க. So the blood has converted into the milk and it is given by the mother to the child. The next one is the mental health is also, not only the physical health. These are the 2 points you should tell the mothers to keep them understand that what is the benefit of feeding your child with breast milk. So you should do it. It is your duty. It is a joy of a woman to feed the child. So she has narrated almost so many positions. And one thing I want to tell in this meeting is that she should not lie down and she should not keep the child close to her chest wall, because few of deaths has been repeated because the breast has forced on the child's nose, so that it has not aspiration, it is just suffocation with the heavy breast when she starts sleeping. And the child's also, it clings to the mother, not sleeping, it is active. So the pressure is so much that sometimes you may lose the child. So the second thing is that from undergraduate onwards, I am asking, when breast is the organ of a woman, and we all talk about her, the breastfeeding and all these things, why the gynecologist should not take care of that, that's the treatment point of it. Either it is a benign condition or a malignant condition. Why the surgeons always need the help of the surgeons to treat it. So it is not a social stigma, but it is a requirement that shapes the child's physical and mental well-being. So globally, only 40, as she has mentioned, only 40% of the infants under 6 months of age are exclusively breastfed. They are not given any other no alternative feed should be given. This should be drilled into the mother's kids when they come to us. From beginning itself, you say that you should not give. அந்த காலத்துல என்ன செய்வாங்க, சீனி தண்ணின்னு they will just put some honey, or sometimes they will put some sugar and they will try to give it to that. Even that should be avoided. And I had seen a documentary film done by UNICEF long back, some 5 to 6 years ago, that task, as Selvarani mentioned, the baby crawl. When the baby was delivered and it was just put on the mother's abdomen, simply it was not supported by anybody. It started slowly crawling and it was getting into the nipple of the mother. So it's already inside. For the explanation given was that the amniotic fluid has the same smell of the breast milk. So it was on in search of the breast milk. So you need not tell them, you need not teach them. You can just bring to the cloth, because it has been already through your genes, it has gone that when it is born, the mother will give her breast for this thing. So these things, and then you by giving breast milk alone, you can prevent 8,20,000 of neonatal deaths per year all over the world. So breast milk, I had seen in my younger days, the women working in our farms, they will be simply bending and they will be bending and doing the work. And 3 to 4 years children used to go for their mother's breast when they feel thirsty. So that was the initial days. Traditionally, even up to 5 years, if it is a male, they will give for a long time. That point nobody insisted, I think. If it is a male, they will give it for 1 year or 2 years. Even I know one pediatrician in our place, she is giving up to 3 years. And if it is a female, they will at least give it for 6 months. So because அது ஏதோ புண்ணியத்துக்கு கொடுக்குற மாதிரி நினைச்சுக்கிட்டு பொம்பளை பிள்ளைன்னா கொடுப்பாங்கன்னு நினைக்கிறேன். Then the other thing is that the antibodies it contains, it prevents infection. It's totally, actually, the AG gastroenteritis is not seen in almost in children who are receiving the mother's milk. At this era, anyway, we have to tell our either she is an educated or uneducated, whether she is from a village or from a town, urban area, we have to tell them. And as I think Dr. the Fogsi president has mentioned, you need not celebrate this for at least 1 week. It should be the whole year. You should be passing on the message and telling them that it is a mother's duty of a mother to feed the child. I had seen in some of the hospitals, they have got breast milk banks for neonate. When the mother has undergone section and she is somewhere else, she is not able to give milk, means the hospital has taken the care of. The government, as per the government instruction in NHM, they are giving breast milk to the neonates of anybody. So there is no discrimination between this thing. That is a very good thing. And maternity leave for 1 year is another again boon for women. It is also to encourage them to feed their children at home and keep them and bring them as a good citizens of India. Then everybody, you will see them, any mother, you just tell that. And you should sensitize the self-help group women or the BHMs or whoever you are seeing in the public. It is better that everybody would be take the relatives, the in-laws, or even we used to say that during HIV, even the mother is infected, counting the positive aspect, you can give mother's milk for a child. So I think Selvarani has prepared a lot for this, and I am thinking of stealing something from her for my book on Thai Paul. So we will publish it. So very I thank Dr. Charmila and especially Dr. Manjula for calling me and informing all these things, making a very grand webinar for us. Very simple word, Thai Paul. Nothing more to speak, but people like Selvarani will prepare for pages and pages, and you can talk for any hours. So that is the holiness of this milk. It is not a simple milk. It is a holy milk, holy food, and it is the first and the best food any child should not be denied of. Thank you, one and all.
Thank you, madam. Thank you for your concern. Thank you for your effort. And thank you, Shiba ma'am. And thank you, Amala ma'am, for chairing this session. We are running out of time. So we are moving on to second topic, breastfeeding recommendations and baby-friendly hospital initiative. Speaker, Dr. Vidya Prabhakar, President of OBGYN Society. And the chairpersons, Dr. Chandrakala Maran, HOD Department of OG, KG PG Medical Institute, and of Coimbatore, and Dr. Gayatri Nirgun, a past secretary from Teni OBGYN Society. Can I have the CV of Chandrakala Maran? Madam is MBBS DGO DNB. She is the head of the Department of OG, KG PG Medical Institute of Coimbatore, faculty for DNB programs at KG Hospital, guided postgraduate students in obstetrics and gynecology and family medicine since 2008. She had organized a national conference in 2010 along with Fogsi, presented papers on gestational diabetes mellitus in National OG Conference at Jaipur 2008, presented papers on comparison of screening procedures for diagnostic gestational diabetes at Dipsy Conference, Chennai 2009. She lectured on new insulins at Yuva Fogsi Conference at Trichy 2009, received Best Doctor Award from Dr. MGR University in 2012, and published paper in national and international journals. Welcome you, madam. Dr. Gayatri Nirgun, She's the director of Gayatri Medical Center from Taini, our own society. She was the founder secretary of Taini OBGYN Society, and she had been secretary for more than 10 years, and she conducted the first workshop in endocrine surgery in 1999. She started her gynec endoscopy unit in Taini. She was the first person to start this gynec endoscopy unit in Taini. Started her first electronic fetal monitoring in Taini. And she was the faculty in AACOG 2019 and 20, member of IAG and IFS, and primary and co-investigator in clinical trials. Her special interest is infertility and fertility enhancing endoscopic surgery. I welcome you, Gayatri. Now, can I request Chandrakala Madam to introduce Dr. Vidya Prabhakar, today's speaker.
Kind words, and I would like to initially thank Manjula and Chamla for having given me this opportunity. And it's a pleasure to introduce Mrs. Dr. Vidya Prabhakar. She's currently the president of OG Society of Salem. She's done her MD-OG from Maulana Azad Medical College, New Delhi, and she's been an assistant professor at KMC Manipal from 1995 to 2000. She's had underwent her ART training at NUH Singapore, and she's also got trained in gynec endoscopy. She's been a senior IVF consultant at ARMC Salem. She's a clinical director of Conceived Couple Care Clinic at Salem. She's been the Tamil Nadu coordinator of Preventive Oncology Committee of Fogsi and from 2022 till 2024. And she's the organizing secretary of ARTCon 2016 and ACOG 2017. And also heard from Chamla, she's been a wonderful organizing chairperson, Fogsi South Zone Conference with Diwar 2022. On to you, madam. We are waiting to listen to your lecture.
Thank you very much, madam, for those kind words. And first of all, good evening, dear respected seniors. I feel that there is a galaxy of seniors over here. I feel actually very much junior. So many senior people around, very experienced people around. And I must congratulate the Breast Committee for organizing this wonderful webinar. And this has been blessed by the president of Fogsi and the secretary general and then the vice president, Dr. Archana Verma. And I must thank Dr. Manjula and Dr. Chamila for giving me this opportunity. And this has seen the pearls of wisdom from so many people, but I must specially mention Dr. Jayam Kannan ma'am, whose thoughts are always very different. She gives a very different outlook to everything. And of course, Amala ma'am and Dr. Selvarani has almost covered most of the breastfeeding aspects. And I think please do pardon me if you feel that many of it is repetition. Can I share the screen now?
Yes, ma'am, you are able to share. Just click on back button on the left side top.
Left side top, okay.
In orange.
Yes.
Go.
Okay.
Yeah, and click on the slide share.
Yes.
Yes, ma'am.
Done. Okay, so we have already seen, we have had all the pearls of wisdom from everyone that breastfeeding is the most important thing on earth for the infants. And this baby-friendly hospital initiative is my topic today. And the 10 steps to successful breastfeeding. Okay, so we have already seen the benefits of breastfeeding, but anyway, just for completion's sake, for the baby, all the nutrients are in the proper proportion for optimal growth and development, easily digestible. Mother's milk is germ-free, as we all know. It provides immune factors, which provide protection against infections like pneumonia, diarrhea, etc. Breastfed infants are more intelligent, protection against asthma and allergy, decreased risk of some cancers. Anyway, so we all know that there is a decrease in cancer for the mother, for the breast, and the endometrium and the ovarian cancers. And there are some other cancers as well, like esophagus and pancreas, which also get protection by breastfeeding. Stronger mother-infant bonding, protection against obesity, hypertension, diabetes, and heart disease. Yes, benefits to the mother, shed the extra weight that she gained during pregnancy. This is a wonderful time to lose weight. Protection from cancers, contraception, lactational amenorrhea, Oxytocin reflex, we all know that oxytocin is a feel-good hormone. So whenever the baby feels, the mother also feels good. So that is also an important advantage. It's convenient, lowers the risk of osteoporosis, cost-free, lowers the risk of diabetes and heart ailments, and of course, emotional satisfaction. And it has been seen that inappropriate feeding practices, suboptimal or no breastfeeding, and inadequate complementary feeding remain the greatest threat to child health and survival globally. And hence, there are some recommendations by WHO and UNICEF. Give the mother to hold the baby in close skin-to-skin contact within 5 minutes, which has already been mentioned. Exclusive breastfeeding from birth till the completion of 6 months. Nothing else except mother's milk, not even water, multivitamins, mineral supplements, balkadu, good tea, gripe water, and all sorts of things which are usually given in our country. Exclusive breastfeeding till the end of 6 months. So that is one of the things which is being insisted upon by WHO. So why should this be there? Because breast milk is sufficient for optimal growth. All the nutritional needs are met with this. It protects from diarrhea and other infective diseases, enhances motor development, turning over, reaching out for objects, and intestines are not fully mature to digest other kind of food till then. So there are some other recommendations by WHO and UNICEF. Introduce appropriate, fresh, hygienically prepared, homemade, mashed, and soft complementary foods at the end of 6 months. So they do not advise to give watery items like rice water, which is actually traditionally given in many parts of the country, dal water, soups, fruit juices, etc. Probably because, they might result in a bit of diarrhea, and probably, it will, decrease the baby's yearning for breast milk. I don't know. There might be so many other reasons as well. And continue breastfeeding at least till second birthday. Converse and communicate while feeding. This is very, very important. We need to tell our patients this, interactive feeding, in order to stimulate mental and emotional development. So now we come to the 10 steps for successful breastfeeding, already outlined. I'll just finish it. Have a written breastfeeding policy. I think Dr. Amala ma'am was just mentioning she wanted to print up some pamphlets and give it to her patients. Well, that's a very good idea. That has been recommended by WHO as well as UNICEF in their BHFI initiative. Have a written breastfeeding policy that is routinely communicated to all the healthcare staff in your hospital. Train all the healthcare staff and skills necessary to implement this policy. Inform all pregnant women about the benefits and management of breastfeeding. Help the mothers initiate breastfeeding within half an hour of birth. Show mothers how to breastfeed and maintain lactation, even if they should be separated from their infant. Sometimes the infant might be sick. Even then, they should be told how to breastfeed and be near their infants. Give newborn infants no food or drink other than breast milk unless medically indicated. Practice rooming in, that is, allow the mothers and infants to remain together 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers, also called dummies or soothers, to breastfeeding infants. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. This is an outline. So now we look into all the steps. Have a written breastfeeding policy that is routinely communicated to all the healthcare staff. Now, this is extremely important because your hospital support staff need to talk in the same language, because sometimes people might say, no, you give for 4 months, you give for 6 months, you do hold the baby like this, hold the baby like that. Now, this is going to confuse the mother. So we should have a clear written breastfeeding policy, and that should be communicated to all your healthcare staff. So how should it be presented? It should be written in the most common languages, understood by patients as well as staff, available to all staff caring for mothers and babies, posted or displayed in areas where mothers and babies are cared for. Step 2, train all healthcare staff in skills necessary to implement this policy. In fact, all of them should be shown, all those, postures that were shown by Dr. Selvarani very nicely. She spoke about so many of those small tips. All these things must be explained to your healthcare staff. Step 3 is to inform all pregnant women about the benefits of breastfeeding. Both the mother and family need to get psychologically geared up for breastfeeding, and this can be done best during the antenatal classes. All family members should provide encouragement, adequate time, and supportive environment for breastfeeding. It is important that mother and her family should be informed and prepared for breastfeeding during the antenatal period. Once the family is convinced of the importance of breastfeeding, they will support the mother for the same. I would just like to say this. Actually, many times I find it is the family, it is the mother and the grandmother. Actually, they should be supporting breastfeeding. But then I find many times, I don't know about your experience, but I find that many times they are the ones who are actually hampering the breastfeeding. They keep telling the mother, oh, she has to sit for so long. She has, the baby is sucking the whole blood from my daughter's body, all these kind of things. And then they feel the moment the baby cries, it should be given something. So immediately they want to prepare something, formula feed and give. So these are some of the things actually the family is doing. They are actually doing harm. So they should be educated as well. So that is the importance of doing antenatal classes. We must include the family in this. Help mothers initiate breastfeeding within 1 hour of birth. Actually, immediately after birth, the mother and baby should have a skin-to-skin contact. Place the babies in skin-to-skin contact with their mothers immediately following birth for at least an hour and encourage the mothers to recognize when their babies are ready to breastfeed, offering help if needed. Now, this is again very, very important because what's happening now is all of us, or at least if not all of us, many of us, we keep the pediatrician by our side when the baby is delivered, whether it is a normal delivery or a cesarean section. So what happens is the pediatrician immediately takes the baby as soon as the cord is cut and the baby is put on the warmer and they do all sorts of things, cleaning and then suction, everything. And then they instruct, please place the baby on the warmer for 1 hour or 2 hours. So the much needed mother-baby contact is lost. I think we need to talk to our pediatricians as well. Do's and don'ts for successful initiation. For the mother, use drugs for labor analgesia judiciously so that she will be able to feed the baby as well. Do not wash or wipe the breast before feeding. Raise the mother's head on a pillow to facilitate mother-baby visual contact. For the baby, a baby who has cried well does not need oronasal suction. Dry the baby thoroughly except for the hands. Do not pass orogastric or nasogastric tube or do gastric suction as a routine. Now, this is for normal deliveries with normal babies which come out crying. This is not for all the meconium stained babies and other or distressed babies. This is for normal babies, and I think normal babies should be allowed to be normal, just like as Madam was saying, for all the animals. For the baby, if the weather is cold, then baby and mother should be covered together with a cloth so that they keep warm while continuing with skin-to-skin contact. So they should be kept warm with the same bedsheet. Delay the injection of vitamin K, weighing the baby, routine measuring, and dressing the baby, wrapping with all kind of new clothes till after the first breastfeed. Baby bath is best delayed to beyond 24 hours. Baby remains comfortable with early skin-to-skin contact and suckling, cries less, and adjusts faster to extrauterine life. Baby remains warm and rapidly recovers from the stress of delivery. Baby is very alert and eager to breastfeed, hence rapidly learns to suckle in a proper way. Early and long-term breastfeeding, if you initiate early, there will be long-term breastfeeding success as well. Step 5, show mothers how to breastfeed and maintain lactation, even if they should be separated from their infants. Sometimes poor techniques and poor latching and all results in damaged nipples, as Dr. Selvarani very rightly pointed out. It results in pain, engorgement, mastitis, abscess, and other things and all result. And what eventually happens is the mother feels fatigue, and overall there is early cessation of breastfeeding. Cessation of breastfeeding during the first month was significantly more common when women used the incorrect technique, with 36% stopping compared with 3.5% when the women were attaching correctly. Step 6, give newborn infants no food or drink other than breast milk unless medically indicated. So the lactation anatomy and physiology, latch on and suckling results in oxytocin release. That releases milk, and the infant then empties the breast. Then the production increases, and then overall milk production occurs. So interference with this cycle decreases the milk supply. So if breast milk production is to be sustained, milk must be consistently and effectively removed from the breast. Unremoved milk exerts an inhibitory effect on milk production, down-regulating the amount produced through chemical feedback inhibition of lactation and physical pressure atrophy of milk secreting cells. Impact of routine formula supplementation, decreased frequency or effectiveness of suckling, and that results in decreased amount of milk removed from the breast, delayed milk production or reduced milk supply. Some infants have difficulty attaching to breast if formula is given by the bottle. So many times this nipple confusion comes, and I frequently find that whenever this happens, when all these mothers are giving formula milk just in between, just so that they should get some rest, or their daughter should get some rest, because it's usually the mothers who advise this. That's what I find. Even the mother who was delivered is ready to feed, but her mother is not ready to allow her to feed. That is somehow resulting in the baby giving up breastfeeding within 3 months. It is something really amazing, and it should not be happening. Step 7, practice rooming in. Allow mothers and infants to remain together 24 hours a day. Enough has been said about it. Remove. These are some things which we need to tell the mother as well, not only about the breastfeeding. So how to wake up the baby, because many times I feel the baby is just sleeping, not drinking. So remove any blankets, change the infant's diaper, or place the infant skin to skin, massage the infant's back, abdomen, arms, and legs. So all these things will wake up the baby. Then of course you can always touch the triggers. So all these things can wake up the baby. So this is another important thing, early infant feeding cues. What we tell our patients many times, in fact, many of our own colleagues will be telling this. Amma, feed pannunga, illena venda. That is what people think is demand feeding. But then the crying is a late feeding cue and may interfere with effective breastfeeding. What they should be told instead is, if the baby is doing some sucking movements, or making some sucking sounds, hand-to-mouth movements, rapid eye movements, soft cooing or sighing sounds, or baby is feeling restless. So all these are also signs that baby is hungry and needs to be fed. Bedding in. Why? Promotes demand feeding, because when the baby is just next and baby starts moving around, becomes rested, the mother will immediately detect and she will start feeding. Keeps the baby warm, reduces infection, helps establish and maintain breastfeeding, because whenever the baby is there nearby, there is a milk let down from the mother. And of course, most important, facilitates bonding. And mother feels much more comfortable. Babies learn to speak early. It reduces the cost overall, requires minimal equipment, and requires no additional personnel to do this. Step 8, encourage breastfeeding on demand. Breastfeeding whenever the baby or the mother wants, with no restrictions on the length or frequency of feeds. I don't know, very often people seem to be under this misconception that baby has to be fed every 2 hours or every 3 hours. So actually that is not required. Give no artificial teats or pacifiers, also called dummies or soothers, to breastfeeding infants. So alternatives could be, our Palada is one of the, best alternatives. A cup, spoon, dropper, syringe, all these things would do. So this is again an important thing that we all need to know, that and we need to tell the people also that infant milk substitutes, feeding bottles, and infant foods should not be advertised, and they should not be forced upon their consciousness. Step 10, foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. So it's very important to counsel them, to provide them support groups. There are some other things that patients might be asking, what about binding the breast or wearing a tight brassiere? So we need to tell them that they need a breast support, but not too tight. And some of the mothers will be asking, can we give express breast milk? I don't know, it's become a fashion now to ask about a breast pump. So we have to tell them that if you want a bonding with your baby, you give it the natural way. So unless there is some contraindication, there is some problem, why should we go for a breast pump? So this is some of the legal and ethical considerations. Government of India in 1992 enacted the IMS Act, and they banned all forms of promotion of infant milk substitute, as I said earlier, all advertisements, gifts and free samples, donation of education materials, and donation of these items, picture of the mother or baby cartoons with label of these items, sponsorship, and payment of commission to staff by companies for promoting sales. All these are to be banned. Okay, so this has already been said. Breastfeeding and work. Let's make it work. So there is this question asked, how should a working woman combine work with breastfeeding? As we have already said, our government has given a lot of importance to this, and they have given maternity leave. And if they want, they can even extend the leave. And even after that, we can, in those cases, maybe we can tell them, if they are going to be away for a long time and their office is far away from their, home, then maybe they can, express the milk. So to conclude, role of health professionals is very important in initiating, promoting, and supporting breastfeeding. By having knowledge and skills, we can help the mothers to breastfeed successfully. Correct attachment and position of the baby at breast is key to prevent many lactation hiccups. Lactation consultant plays a very important role. Now, this is coming up in a big way. I think there are online courses. People can do lactation consultation to promote, protect, and support breastfeeding. And so newborn deserves the best nutrition, improved survival, and optimum development and healthy life. Thank you very much for the opportunity given. Thank you very much, Dr. Manjula, once again, and Dr. Charmila for suggesting.
Thank you, Vidya ma'am, for the very nice talk. Actually, government hospitals, the breastfeeding initiated within 1 hour is considered as one of the quality standard for that hospital. When you're talking about this baby-friendly hospital initiative in government hospital, when all the babies are breastfed within 1 hour, the standard quality standard is the highest for that hospital. That's what they are assessing the hospitals in Lakshya program. Now, may I invite Gayatri Nirgund to conclude the talk and conclude the session to share her thoughts.
Thank you very much for giving me this opportunity to talk about and concluding the wonderful talk given by the previous speakers. I first thank our Fogsi President Shantakumari Madam, Dr. Archana Verma Madam, Dr. Madhuri Patel, and Dr. Sneha Boyar Madam, with whom I shared the platform during the Lucknow AICOG during the panel discussion of breastfeeding techniques. But the talks initiated by Dr. Selvarani was excellent in that coverage, and Dr. Vidya Prabhakar has covered the 10 steps of baby-friendly hospital initiatives in such a wonderful way that there is hardly anything that I could add on. The one thing that as a gynecologist that I would like to remind time and again, even though we know, is to look at the breasts of all antenatal mothers during their antenatal checkup periods itself, to look for inverted nipples. Sometimes this causes a big problem for initiating it, even though the mother is very anxious to start the breastfeed at the immediate first hour or the first 5 minutes by crawling, but she did not know that she had a nipple problem. But this is something which we as gynecologists need to examine the breasts at least at the 3rd trimester visit. Make sure that the breasts are ready for initiating the breastfeeding at the immediate first hour itself. Otherwise, the antenatal classes and counseling and the same language to be talked by all the staffs of the hospital regarding the latching, regarding the demand feeding, and regarding the duration is all wonderfully explained by the passionate speaker, Dr. Vidya Prabhakar, whom I listened to during her Kanchipuram Society's talk on day 2. So even though I missed the talk in Salem, Fogsi ma'am, I had an opportunity to listen to you during your Kanchipuram Society talk, and I was very impressed by your passion that you had shown during that talk, and which reflected in your talk during this breastfeeding initiative as such. So I know that we are already running late, and the panelists are eagerly waiting for Dr. Sneha Boyar to start and conclude. So I thank once again the organizers, Dr. Charmila ma'am, Dr. Jayam Kannan ma'am, Dr. Shantirani, and the other senior dignitaries, Dr. Manjula, for giving me this opportunity to chair this session. Wonderfully done. Thank you very much once again. Over to you, Dr. Shantirani, for the beginning of the next panel discussion, which is being eagerly awaited. Thank you again.
Thank you, Gayatri, and thank you, Chandrakala ma'am, for chairing this session. Now, the next session is, as Gayatri noted, that's the very interesting session of panel. So, can I have Manjula madam?
Yes, ma'am. We move on to the next panel discussion, problems in breastfeeding. The panel moderator is Dr. Sneha Boyar, Chairperson, Breast Committee Fogsi, GCM ICOG Fogsi. The panel expert is Dr. TV Chitra ma'am. Can I have the CV of Chitra madam, please? Madam is Professor and Unit Chief, OG Department, PhD in IMSR, Coimbatore. She was President of Kowai OG Society, Scientific Committee member of Fogsi 2019, member of IUGA and ISUOG. Her special interests are urogynecology and high-risk pregnancy. Honored by Teaching Excellence Award 2015 by the institution. Postgraduate teacher and examiner from 1998. Faculty in the Institutional Medical Education Technology Cell. Has been invited as faculty for many national and international conferences. Organizing
make it short, Manjula. Enough.
Okay, ma'am. Has many publications in national and international index journals. I'm very happy to invite you for this platform. She's my professor in my undergraduate days. Happy to invite you here, madam.
Thank you, Manjula.
Neha, madam. Neha, madam, you can proceed with the panel, please.
Yes. Thank you so much, dear Manjula. And without wasting much time, I think we should go straight away to panel discussion. So much has been said and discussed about breastfeeding. I think all the benefits to baby, to mother, to family, and the nation, everything has been covered. So we straight away go to what are the problems in breastfeeding. And of course, what are the barriers to breastfeeding as well? So I think just little mention about this oxytocin reflex to when we talk about the correct technique. In this picture, you can see the baby sucking at the breast. The sensory impulse traverses to the posterior pituitary, then there is release of two hormones, that is prolactin and oxytocin. So the prolactin is responsible for the baseline or continuous production of the milk, whereas oxytocin is responsible for the milk let down for that particular feed. And that this is what we call it as oxytocin reflex. And that is why much is discussed about it, because the milk let down, the adequacy and continuation, everything depends upon this. Whenever the mother listens to the cry of the baby, she just hears the sound of the baby, maybe just think lovingly about the baby, or just, the sight of the baby, she starts her milk letting down. And if at all she has the confidence that yes, she can breastfeed a baby and the baby will suck well and everything will be fine, that should boost and help the reflex. On the other hand, if she keeps on worrying, having stress, pain, doubt, this will hinder the reflex. So I'm not going to go once again repeating these benefits and all these things, just to say that yes, what problems are there with the breastfeeding. I think when you should start and all these things, I will straightway go to the much has been discussed about the positions also. Because of lack of time, I will go straightway to the cases. So may I have the first panelist, Dr. Manonmani. Madam Dr. TV Chitra, I welcome you as expert. Anytime you feel to make some comments, you can please go ahead. I will just start with the first panelist, Dr. Manonmani. Madam, this is a case for you. She's a primary para patient, just delivered today. And when you was, as everybody is saying, yes, you're making a habit of immediate breastfeeding. So she started feeding her baby and she just noticed that she's having a blood-stained discharge. How will you proceed for this patient?
Good evening all. First of all, I would like to thank Dr. Chamila, Dr. Manjula and Dr. Shantirani and Dr. Sneg yourself for giving me this opportunity. And this case, she's a low risk primary. I would like to know, does she have any other complaints apart from the blood-stained discharge? Is she having any pain or is there any fever? And I will ask her the questions. If there is no pain or no fever, and I would like to examine a breast. If there is any lump or if there is any inflammatory swellings or any swelling in the breast.
Correct.
If it is no complaints of any patient doesn't complain, or if there is no clinical examination findings, I will reassure her because it is one of the few common things. Because of the extreme vascularity, sometimes the breast milk might get change in color, blood stained or a rusty color.
Yeah, just to make one comment here, whether you would examine both the breast and see whether it is unilateral or bilateral.
Yeah, definitely. I'll examine both the breast. I will see for any lumps or any inflammatory sign, or if there is any lump in the areolar region or any cracked nipples or any nipple discharge, any infection in the nipple.
Right, that you have said, whether only unilateral or bilateral, does it make any difference?
And it can be unilateral and bilateral also. So I will reassure her if there is no symptoms or signs, it will resolve within 3 or 5 days. If it doesn't, and then again, we shouldn't get alarmed. We should teach our healthcare personnel, staff nurses, and overall looking after the patient as well as the attendants and the patient that it would be a normal physiological thing, which will improve once within 3 or 4 days. The baby accepts the milk and doesn't have, baby doesn't vomit or any of the discomfort to the baby, even that milk can be given, no harm in that. If it doesn't come down or if it doesn't become normal white colored milk by 4 to 5 days time, then I might think some problem and we can go for cytology of the breast milk if there is any, and then as well as we can go for the mammogram also to rule out any very rare pathological association.
Okay. Yeah. So this is what you have already said, that yes, you would like to ask us some history, whether she has some infection, trauma, what you have already said, nipple, maybe sore nipple, already some trauma to the nipple, inflammation, or maybe some ulceration which is pre-existing there. Yes, but basically you have already said that yes, whether it is associated with lump in the breast, and most important, whether it is unilateral or bilateral, because if it is usually bilateral and if it is only transient, you will just explain her that yes, it is physiological because of the condition, and initially you may just have this blood stain discharge which will clear off over the period of time, as you have rightly said, 3 to 5 days. And of course, when you see that it is persistent, you will think of the papilloma and the rare possibility of PABC. So,
can I just comment?
Yes, of course. I'm coming to you.
Oh, yeah, sure.
Please. Yeah.
Okay.
Please, go ahead.
Thank you, Dr. Sneha, for having given me this opportunity. And I thank Dr. Manjula, Dr. Charman, and all the experts who've been there. Regarding the first question, the answer was, I would just like to say mammogram may not be done because these patients are quite young.
Yes,
I think
exactly.
ultrasound, like you said, ultrasound is sufficient. Mammogram is normally done only after the age of
40 years.
Yeah, so we normally don't do mammogram. So I think whatever Madam said was correct, because we only have to think of papilloma if it's persistent, and ultrasound would be the first line of management apart from your cytology and all this if it's persistent. Otherwise, you could just counsel it saying that it will be over in another few days.
Okay. Yes, perfect. The recommendation for mammography is by various organizations. Younger than 40 years, it is ultrasonography, and more than 40 years, it should be mammography, because the breasts are dense and ultrasonography will be the best one to differentiate between the solid and cystic lesions as well. So I think that clarifies everything. So we now move on to the next panelist. And here we have a 32-year-old primary para, who just delivered 10 days back, and she's brought to your hospital with difficulty in breastfeeding. So what can be the various causes of difficulty in breastfeeding? The next panelist, I think, can take up this question. Anybody for that matter.
Dr. Vanita, Dr. Vanita.
Dr. Vanita, you can take up this question.
Since she's delivered 10 days ago, and she has delivered 10 days ago with complaints of difficulty in breastfeeding, and we should ask the patient about how is she breastfeeding and whether she's feeding the baby proper way. And And we should look for the examination of breast, like whether she's having any cracks in the nipple or whether her breasts are getting engorged and she's getting proper milk secretion to feed the baby.
Yes, madam. Yeah, sorry to interrupt you. Difficulty in breastfeeding. I think before it may be just difficulty in the latching. So right from the nipple shape, you can talk, madam. No problem.
Yes. You should, as already the speakers told about the proper latchment and positioning techniques. You should ensure the mother and should help her how to hold the baby and to breastfeed.
Okay. So what we mean to say is difficulty in feeding can be, the reasons may be varied, right from, she may not be able to hold the baby properly. That may be one reason. Or maybe the baby is not latching properly because the baby may be sick, or maybe may be having swollen tongue, edematous tongue. That is one. She's not able to feed the baby properly because there may be flat or inverted nipple. And then, of course, the engorgement, mastitis, cracked and sore nipple, then, of course, all these possibilities can be there. So, suppose, madam, if she has nipple like this, so can she breastfeed her baby?
By syringe technique, we can try to revert the nipple back and help her to.
Yeah. So still more, if at all, see, basically what we are talking about, proper and effective latch, where the baby is supposed to have nipple and part of the areola inside the mouth of the baby. So when we are talking about proper, good latch or effective latch, it's not the baby attaching to the nipple, the baby attaches to the breast. And that's why even if she has this flat or inverted nipple, with proper support and technique, she can be helped and to overcome these problems. So these are the problems which make the difficulty in feeding. And this can be corrected, as you have rightly said. Yes, you can do manual correction, you can do syringing, and maybe you can use some other manual measures. Maybe sometimes if it doesn't help, then what will you do? Suppose all these things don't work, then what will you do for this patient? Basically, Dr. Vanita, you are right. Actually, I'm just trying to clarify for the other people that mothers having flat and retracted nipple, as somebody has said it already, that you have to antenatally notify it, and maybe during 9th month you may just advise a gentle manual correction, not before that. But even if she has this kind of flat or inverted nipple, she can definitely breastfeed the baby, because the baby attaches to the breast and not to the nipple directly. So, so the technique being, you ask the baby, you make the baby open mouth widely, so that, sometimes you just touch the nipple to the baby's nose. You try to bring the nipple closer to the baby's nose, so that the baby goes back and opens the mouth widely. And that is how you can succeed in effective latch for these particular patients. Okay. So, yeah, any comments?
Madam, I fully agree with what Dr. Sneha said. Actually, routinely around 36, 37 weeks, we should examine every patient for the breast and look for small things, see what is the texture of the breast, see whether she has any flat nipple. But like how Dr. Sneha said, a flat nipple is not a contraindication. In fact, many of the lactation consultants, they say you don't even do a syringing. They don't advise syringing. Not everybody advise syringing. They say even if the nipple is flat, you can allow them to suck, because it's only the breast which the baby sucking, not the nipple. So automatically the nipple will elongate. But if the patient is very apprehensive, or if we are apprehensive, we can do a syringing with a cut. We can just cut the syringe one end, and then we can use the barrel and then draw out the nipple. That can be done. And the other thing about antenatally, don't go on stimulating the nipple. Try to draw out the nipple, because that might predispose to preterm onset of labor pain. So that also should not be done. So you tell her not to do this, because unless she's nearing term, that should be careful.
Yes, so very well described, madam. In fact, that is what the message is, that don't get scared of flat or inverted nipple. True inverted nipples are extremely rare. If you just try and, make the areola, you stretch it, the nipple protrudes out. That is what the action is. That is only needed. And you may just manually stimulate during 9th month or near term, not before that. That is a message. Even if you have the nipples like this, you can still breastfeed with the technique I have said. In fact, the lactation consultants, they are strongly against syringing or pumping of these nipples, because that may cause further trauma to the nipple, which may worsen the situation. The nipples will be painful and the mother may resist, or she may be feared of breastfeeding. So we want the breastfeeding to be a pleasurable experience, enjoyable experience, and not a painful one. And that's a very reason. Going ahead with the nipple shield and all these are absolutely contraindicated and should not be used. That is a message here. Gentle stimulation and support should be, that's all. So now we come to Dr. Nirmala.
Yes, I'm here.
Yes. Hello. So you have this primipara delivered 5 days back. She comes to you with little fever witches and overfilled tiled breast with the shiny nipple. You can see here. And she has lots of pain in the breast. When you examine, you find that the breast is enlarged and tense, tender. And when you try to squeeze deep for the breast milk, the milk is not flowing. So what is your diagnosis, and how would you, before management, I would ask you why this condition has happened? What has led to this?
Thank you. So it looks like it's a case of breast engorgement with mastitis has set in. So on examination, I would look for whether it's unilateral or bilateral, and whether there is any impediment to proper lactation, which could be either the nipples in the mother, like cracked nipples, or in the baby, whether the baby is not latching properly or has a tongue tie and or is a weak baby. And sometimes it could be even blocked ducts, lactoferous ducts, and that can also cause a similar problem of not having milk let down, leading to mastitis. Whatever the cause, the important thing is the milk has to continue flowing. So I would give a warm compress and or apply warmth on the breast and help the let down and help the baby to continue feeding at regular intervals. And if the baby is not feeding enough, then probably express the milk out manually. And after feeding, the baby, if there's a cracked nipple, that needs to be taken care of with emollient.
Dr. Nirmala, she doesn't have a cracked nipple. So,
okay.
Yeah. Okay.
So, antibiotics if it persists, and if there's a fever.
At present, she doesn't have any infection. It's only a engorged breast, wonderfully managed by you. Now you advise others how to prevent this. Why this has happened?
The reason would be that the milk flow, there's engorgement because the milk is not flowing out enough. So that could be because either the baby has had a long interval of between feeds, maybe it's also being supplemented by other artificial feeds, or maybe the latching is not sufficient. So the some parts of the breast are not being drained out properly, some quadrants, or there might be a blocked duct, which we haven't noticed, and certain lobules might get engorged.
So in fact, she is not, she has not initiated the breastfeeding at the earliest. Maybe she has not assured the good attachment. Maybe she's not feeding the baby completely at frequent intervals. So encourage early initiation, ensure good attachment, of course, frequent and complete emptying of the breast. It should be unrestricted feeding. Very well said. Now, if you have the baby with the mother and the baby sucking well, why do we want to express the milk? Baby's mouth is the best from. So you have to attach the baby to the breast so that it sucks out everything. But if the baby is not with the mother, then of course there comes the express breast milk. Now, how do you express the breast? Tell me.
First is apply warmth.
Mm-hmm.
and then make sure the mother is relaxed.
Mm-hmm.
Nipple stimulation and also like touching the nipple gently, and also having the baby in the mother's hand or close to the mother will help the milk let down in a more
Very
easier
good.
way.
Yeah.
And
and then gently you express it like this. Not all of a sudden you go and just squeeze. That will be very traumatic, painful to the mother. So first you counsel her that we are going to do this. It will relieve your pain. So she will be ready. And then you, after counseling, you put your 4 fingers below and thumb above and gently you squeeze like this. Okay. And then if at all it is not possible with hands, you can do it with the various pumps. Yeah, which may be manual or battery operated or electric. And of course, at the end of expression, you will do what is called as cold compresses, which you can do it either with the ice packs or these cabbage leaves, which are frozen. They themselves are very healing and soothing. So wonderfully discussed, Dr. Nirmala. Now we go to this third case. So this we have Dr. Para 1. This is for the third panelist, Dr. Sarvana Kumar.
Yes, ma'am.
Yeah, hello, Dr. Sarvana.
Hello, madam. Good evening.
Good evening.
Thank you for the invite.
So
Yes.
we have this Para 1 delivered 3 days back, and she's come to you with severe pain in the breast and nipple, just not allowing the baby to feed, and relatives are worried. When you examine, you find this picture. On one side you have this, and on the other side you have this. This is the picture. What is the diagnosis, and how will you manage?
Sore or cracked nipple sometimes is very commonly seen, and the thing is, it's many times because of the improper latching of the baby, this happens. And sometimes what happens is the baby, when it takes only the nipple, and that causes the problem of a bite over the nipple and causing some amount of infection. And the other rare causes maybe when the patient is using using soap or anything to
wash or clean the nipples.
To wash, and then that causes a lot of some sort of dryness and dermatitis also. That can cause this sort of soreness. So, and the only thing is, so this oral thrush of the baby also may be one reason. So if we properly examine, and if it is just this is a soreness, give her some antibiotic if there's an infection, or we'll just put her some with a emollient, and the patient can feed from the other breast and express the breast milk from this breast. So that will help it to heal. In another 1 or 2 or 3 days, she'll be able to feed from this breast also. We will give her good analysis, and probably a cold compress, like how you said, this cabbage leaves can be kept, and then that will help the patient a lot.
Correct. So as we have already said, that it should not be a painful experience, because this is the major cause. These are the major causes, for cessation of breastfeeding, which we do not, as obstetrician, rather we should not make them land up into this situation. And this is mainly, it happens because of the improper latch. The baby is only chewing the nipple. That's the very reason it's getting, necrose. So, and what you have already described, yes, cleaning it with soap water, repeatedly drying it damages the normal flora as well. So, as you have already said, if ineffective or improper latch, that may be the reason. Correcting the latch, that itself may solve the problem. And then, of course, as you have very well described, that symptomatically how you treat the care of the sore and cracked nipple, how you have to feed from the opposite near normal nipple or breast, and of course let the milk flow automatically from this side. You can even collect that milk which is automatically laid down, and you can use it for the baby. Of course, as you have already said, that 3 to 5 days, it will heal on its own. So not to worry much, but yes, definitely you should take care of such situation, handle them immediately, and see that the breastfeeding is not stopped or not, it is not, on a standstill. That will worsen the situation. So, Dr. Sarvana, you have this one more patient. Suppose your patient has this picture. The breasts are, one breast is angry red like this, and the other one is, the nipple areola, it's like this. So this is also the cause for painful breast and nipple. So how would you manage this case?
Yes, this seems to be like a thrush infection.
Yeah.
So we need to, anti-inflammatory has to be given, analgesic has to be given, cold compress along with the antifungal, which we have to give. And to prevent secondary bacterial infection, we have to give a course of antibiotic also. So, and I temporarily stopping breastfeeding from this breast, and we need to see about the other breast also.
No, we don't recommend. Rather, the guidelines don't recommend stopping of breastfeeding. The breastfeeding has to be continued. Management of the mother, management of the baby, because you don't know whether it is the oral thrush first and secondary infection of the breast, or it is the maternal fungal infection which has led to the breast fungal infection. So infection has to be treated from both sides, and it has to be systemic as well as local treatment. So systemic, you give oral antifungal as well as locally you give antifungal ointment as well. Dr. Vanita, would you like to add something to this case? Would you like to discuss this? Dr. Vanita? Do we have Dr. Vanita?
She's not there. I think she was there.
Okay.
We lost her. I think she might join back.
Okay, so doesn't matter the case we have. I think we have received the message that she has left. I think so.
Vanita is there, madam.
Yes,
Madam is there.
Yeah.
So we need not stop the breastfeeding, ma'am. Even if there is a case of
yes. I think I would request you to discuss this case in details.
Yes.
Yeah, please go ahead.
The mother will be having candidiasis of breast. In the case, she will be having redness or rashes, or the nipple will be looking bright red or pink in color with some flakes over the area.
Yes, that pictures we have given you. Pictures we have given you that she has presented with this picture. How do you treat this entire condition?
Yes, ma'am. Proper hand washing before handling the baby, and washing of the breast, and patting the breast dry to prevent the moisture over the breast, to prevent further more infections. Applications of antifungal creams both to the mother as well as treating the oral thrush of the baby with antifungal paints.
Yes. So it has to be systemic as well as, it should be systemic as well as local. For the mother, that is the local for the breast as well as vaginal infection. Usually the mother has associated vaginal candidiasis. So entirely we have to treat the mother and the baby, and systemic as well as local antifungals. And as you have very rightly mentioned, you have to keep the area dry, clean and dry. That is very, very important because the moisture, it invites fungal infection, and that's the very reason. Don't allow the milk to be there, all the time leaking. So many of the patients, they keep the clothings, keep the cotton for, if the milk is just falling down, they keep some cloth so that moist cloths worsens the situation. So what we are supposed to advise them is keep it clean and dry. We're not supposed to allow them, using cloth which keeps it dampens the area and worsens the situation.
Sometimes
what antifungal? Yes, what antifungal you want to use, Dr. Vanita?
Itraconazole, oral itraconazole or cystatin or iconazole can be given.
Yeah, itraconazole or fluconazole, correct, orally. Locally, what you want to use? for the breast and for the baby's mouth?
Application of metronidazole ointment for the mother. And just before breastfeeding, she should wash the breast and then feed the baby after.
Okay. Previously, you must have seen the people applying junction violets. Yes, to the breast also, to the baby's mother also. Nystatin was also is still being used at some places. But yes, because now we have these ointments now easily accessible and available, I think fluconazole ointment is the best one, which we are using as a routine. So antifungal for the mother, for the baby, systemic as well as oral. That is what should cover this mother well. Madam Chitra, do you want to add anything here?
I just want to say, like you said, you don't keep a wet cloth. You can even, many people recommend air drying also.
That is what is the treatment of sore and cracked nipple was Dr. Sarvana was describing. Yeah, so you apply in fact the milk. Previously, I just want to clarify this myth that previously even I have heard few obstetricians advising the patient that you keep the breast clean. So clean them repeatedly. Once you feed the baby, you clean it, wipe it out. So that is wrong. In fact, that favors or that leads to cracked nipple, that leads to cracked and sore nipple. So what you have rightly said that you're not supposed to keep it washing all the time, but should not keep it moist also. It has to be, the milk has to be air dried. That also helps the sore nipple to heal, and of course that helps to avoid fungal infection, both sides. So thank you, Dr. Chitra, for adding your valuable inputs. And Dr. Vijaya, now we come to you. You have this patient, yeah. So she's a para 1 delivered 3 days back only. She says, madam, it's very painful. I just can't breastfeed my child. And when you examine her, you find she's got fever, tachycardia. Both the breasts are enlarged and tender, red hot, and there are no axillary lymph nodes. This is the picture. What is your diagnosis and how will you manage this?
Good evening, madam.
Good evening.
This is the common lactation.
I think, madam, you need to shut down your other device. That's making echo. Yeah. Thank you.
Vijaya, are you there? Somebody's echoing.
Mastitis, madam. Mastitis, madam.
Vijaya, have you logged in 2 devices, Vijaya?
Yeah.
Are you having 2 devices, 2 mobile or 1 mobile?
Yeah, she's trying to shut it down.
Yeah, only you just shut down, no?
Yes, ma'am.
Okay.
No, it is still echoing. Yeah. So, okay.
Ma'am,
so
just mute other device, ma'am.
Yeah, that's all. Just mute the other device, Dr. Vijaya.
It's a common lactation preventable problem, madam. This is mastitis, madam. The patient is complaining of fever, tachycardia, and enlarged tender breast on third day of delivery. So we have to think of mastitis, madam.
Yes. How will you manage?
We have to examine the breast. We have to look after the cause for the mastitis. It may be due to third day it is coming in. Mostly it is due to milk stasis and incomplete emptying of the breast. So we have to make sure the breast should be empty in a complete manner.
Correct.
For that.
Yes, you're right. Go ahead. You're discovering. Please go.
Mastitis due to milk stasis and infection. For complete letdown, we have to give warm compresses, or we have to make the patient comfort to continue for breastfeeding. So we have to give a comfort by either warm compresses or by cold compresses like cabbage or jasmine and all, ma'am. and we have to give antibiotics to prevent the further mass access.
Yes.
If it is untreated or negligent, it will proceed to breast abscess, ma'am.
Correct. You are very correct. You have described it very well. The specific management and the general or supportive management. You have very well said.
We have to give antibiotics in breast milk for baby also, common.
Correct. So, yes, so you have described it very well that you give cold compresses, you counsel the patient gently, you try and massage, stimulate the rather not massage, but you stimulate the breast, and you put the baby to the breast so that it empties the breast. If not, maybe you need to manually express, which is actually very, very painful. So best way is to put the baby to the breast, and then of course you give antibiotics and anti-inflammatory. Before starting this process, you give warm compresses. At the end of this process, you give cold compresses. So that should solve the problem. Now, why this has happened, you have already said that it is because of milk cesses, ineffective milk removal. Maybe the baby is not latched well, that's why it is not effectively pumped out. Maybe sometimes she's got the cracked or sore nipple. That's the reason the mother is feeling very, painful situation. She doesn't want to feed, so the milk stasis has happened. Of course, certain restriction from tight bra, whether you have localized retention of the milk within few of the glands, which is not drained out properly. Sometimes you have, as we have discussed, the syringing or even the manual breast pump, you're trying to, suck it out. So that's also very painful and may cause some trauma. That's the reason this mastitis happens. So rather than doing good to the patient, we are doing more harm by doing all these things. So best way is to go by natural means. You make her initiate the breastfeeding as soon as possible. As we were discussing about the recommendations, the government of India has come out with MA, the mother's absolute affection, where they recommend the delivery of the baby on the mother's abdomen, and before cutting the cord, you make the baby crawl towards the mother's breast. You just support it gently so that the baby starts, sucking on its own. That is how that early we should do it, whether it's a normal delivery or it's a cesarean section. And nowadays we are practicing this since last 2 years. I myself is doing this and advising whosoever comes in contact. So that gives wonderful results, and we are happy to share with you that we are not having majority of these complications now, and the patients are happily breastfeeding their babies. So continuation rate or maintenance of breastfeeding, which is a major achievement because of this major support. So you have already discussed all this, that hot fomentation and gentle massage, all these things you have already discussed. Now suppose what antibiotics we will discuss when we come to the next patient. You have this next panelist, the last one, I think. Last case we will discuss is this Dr. Vijay. Vijay has already done. So we have one more case. We can discuss this last case. Anybody can take a few of these questions. Suppose your patient has not responded, or maybe you get the other patient of similar kind. This para one who has undergone cesarean section 10 days back, and now she's come to you back with high grade fever, with chills and painful lump, lump in breast as well. And you examine, you find that the pulse rate is high. She's got breast engorged. Both the breasts are engorged, red hot and tender. And you have the left breast with a lump of 6 by 6 centimeter. What is your diagnosis and how do you manage this case? I think the first panelist can take up this.
Thank you. Thank you, ma'am. She's
Dr. Mananmani, yes.
She has 10 days, so has got 10 days old baby with all the signs of febrile tachycardia with engorged breast with a lump of 6 into 6 centimeters, so probably a case of breast abscess. So we need to drain this, or else she'll go for septicemia. And the treatment is we have to admit and give antibiotics and have to do a drainage.
Ultrasound guided aspiration we can run for this case. So this is the case of breast abscess. Ultrasound guided aspiration of the pus and antibiotics will help this.
We will consider you, both of you. Dr. Manoharmani, are you in favor of open drainage, incision and drainage?
She's yeah,
ultrasound. Please express your view, then we will discuss.
This patient coming with 6 into 6 centimeter lump and ultrasound guided repeatedly we have to go, and so better we admit, and normally we do, and because we don't do ultrasound guided, we go for the.
Suppose this is a very superficial abscess.
Superficial,
very well.
then,
yes.
Superficial,
so
then
do,
we can
do
go
we
with
need ultrasound still?
Not ultrasound is not needed. If it is superficial, we can with the wide bore needle we can just drain it.
Yes.
Or aspirate, and only thing the pus shouldn't get the needle blocked. So the wide bore needle we can.
So what bore needle you want us to use?
Yeah, 16 or 18.
14 or 16. Should be very big, because thick pus usually it is 14 or 16. Okay, very well. So you are not in favor of incision and drainage, right?
Yeah, if it's superficial and we can go for drainage, or else
Deep seated means we have to go for ultrasound guided wide bore aspiration. Superficially,
Dr. Vijay, see,
we can put a nick and open drainage. We can do.
That's what. No, but see, as obstetrician, I'm sure way back 10 years back, we used to do this only, that whenever such patient come to us, we used to refer to surgeons. You must have seen such patients. When you refer to surgeon, what they do, incision and drainage, and they have a huge cavity there. Okay, then we can't suture it. They leave it for secondary healing. Then the daily dressings, they are so painful. And the milk is also, because the ducts are also cut, so milk is also free. It makes all things messy. So what they do lactation suppression. So as obstetrician, do we agree to this procedure, or do we have some other option? Basically, pus anywhere in the body has to be drained out. But is this incision and drainage the only option for us? No. As you have rightly said, needle aspiration. So if it is a small abscess, yes, maybe just a single sitting aspiration would be all that is needed, along with antibiotics and anti-inflammatory and supportive measures. But because this is a larger abscess, maybe you require repeated settings of aspiration. Because if it is a superficial abscess, you don't need ultrasound. Only few of the, you have loculi, but for that you don't need ultrasound. If it is a deep-seated abscess, which is not easily accessible, I think we can go ahead with ultrasound, and you find that there are multiple loculi and you drain accordingly. For this abscess, which is superficial, why we should prefer the needle aspiration? One, it doesn't require any surgical procedure. It's not a surgical procedure, because surgical procedure requires anesthesia. It leaves you open wounds, painful dressings daily, and lactation suppression, which is not our aim. This procedure gives us the advantage that it does not require anesthesia and stopping of breastfeeding. It gives us an opportunity to continue the breastfeeding, which was in fact the problem. What has happened, that because she has not breastfed the baby properly, she has landed up into this problem. So our aim should be continuation of breastfeeding and not lactation suppression. That is what all of us are trying to do, right? So that is what the message from our side, and it's not only theoretical. We have a member, we have few members with our committee. I myself, in spite of being Dr. Bhuyar, my husband being a surgeon, we don't go for incision and drainage. We have two options. One is needle aspiration, as we have discussed, and second is you can just take a small nick and leave a small drain inside. How they do it for the other breast surgery, if at all they have the bleeding or oozing from that area. So you leave a small small drain there. That can, repeatedly within over 2 to 3 days, it will drain out everything and the wound will heal from below. So you don't need to pack. I think these are the two options for us. And at this point of time, we don't recommend incision and drainage unless you have a very big abscess which is not responding to your antibiotics, anti-inflammatory, and the needle aspiration. And this is not only theoretical. We have few members who are actually presenting the data on this. More than 120 cases they have done over last 5 years. They have presented to some conferences as well. So this is a proven cost-effective treatment, I would say, with a very good experience of continuation of breastfeeding. So, madam, over to you, Dr.
Can I just add a comment? It was really excellent, Dr. Sneha, especially the last point that you were saying. I think all of us should know that this is an important point. Many of us patients will first come to the obstetrician whenever they have this abscess. They're not going to go to the surgeons, and we are the ones who are referring them to the surgeons. Like you said, it's very important that we try to do very, very minimal invasive procedures like a needle aspiration. And for everything, we have this interventional radiologist. You have pus anywhere, they put in a needle and then they drain out. If you're not confident, you could always ask them to do. I think that's a very, very good message which all of us should follow. No INDs, because like you said, it's very, very painful. Sometimes it takes months, days on. They have such a big cavity and then they go on draining. Plus, like you said, milk goes on coming out. It's not all comfortable for the patient. Patients after delivery, they're not all comfortable. They have so many problems with breastfeeding. What all they look forward to eagerly, all their dreams are shattered when they have all this. So I think this can be simplified in a very simple needle aspiration. So that's a good take-home message for all of us.
Yes.
Yes,
so, yeah. So, friends, I think, end my panel discussion here. I will just give you my concluding message, and I will I request all of you I request all of you for my candidature as Vice President Fogsi West Zone for the coming elections. I'm trying my best, working hard for the committee as well as ICOG. And of course, I will continue to work for Fogsi. So with this, I just stop sharing. And discuss what are the good breastfeeding techniques. So I think we can have one point from all our panelists, and that should conclude our panel. So we start with Dr. Manav Mani.
Yes, we should have the hospital breastfeeding hospital friendly initiative. All the government hospitals, as Dr. Shanti Rani said, we breastfeed within 1 hour. That is a policy everybody should follow. Because some private hospitals, that policy had not gone down to all the level. So that should be practiced, breastfeeding within 1 hour, either a normal delivery or for cesarean section.
Correct. Very good. Yes, Dr. Vijay, yes.
The breastfeeding initiatives should start before delivery. So in the late antenatal period itself, the counseling should be given to the mother. And once she starts
not only to the mother, I would still say.
And to the relatives and her family, yes.
To the father and to the in-laws, the family, yes.
To the family. And the initial breastfeeding should be supervised so that she learns from the right technique from the qualified people early on, instead of from the relatives.
Okay, Dr. Vijaya.
Health education and prevention of infection should be taught to each and every antenatal mother and immediate postnatal mother, madam. Prevention of infection, the hand washing technique, the how to manage the breast during the breastfeeding, and latching on techniques we should explain during the immediate postnatal period when the patients are with us.
Dr. Sarvana Kumar.
Simple problems which they routinely face in the postnatal period, that has to be explained to them. Otherwise, these people, they will stop breastfeeding just because they have some problem. So we have to tell these are the problems that you may face during breastfeeding. The sore nipple, cracked nipples can happen, and that it is nothing that you have to stop the breastfeeding. You have to come to us, and then we will try to help you out and rectify the problem. Otherwise, this they stop the feeding. That should be discouraged.
Good. Very good. Dr. Vanita?
Exclusive breastfeeding for 6 months completely, and no artificial is to be given.
Perfect. So with this, we just say that yes, first and foremost, how she should have her position. The mother should be well exposed to the baby. The breast should be well exposed. How the mother should sit, she should sit comfortably. And the baby also should be held comfortably. Though we talk about various positions, cradle hold, cross cradle hold, football hold, Australian hold, and sideline position. Here we would just say, whatever position the mother is comfortable, she should feed her baby. May it be sideline position even when, especially when she's tired, exhausted, or maybe operated, as we all of us are watching. How should be the baby? The baby should be well supported from the back. It should be in a neutral position. The head, umbilicus, and the entire body should be in a neutral position, so that even if the mother is sidelined, her chest or breast and the baby's tummy should be in touch. The skin to skin contact should start from that point of time. It should not be twisted. The baby is lying straight or flat, supine, and then you're trying to just twist the neck. That is not a good technique. Attachment, we have already described that it should be a good or proper latch. If it happens easily, well and good. If it doesn't happen, then you have to try and touch the nipple to the baby's nose, so that the baby opens the mouth widely and the nipple and the part of the areola goes straight inside the baby's mouth, so that it covers nipple and part of the areola, and then it effectively protrudes the lower jaw and make a negative suction. When should we start? Everybody has very well described. It has to be as early as possible, but preferably before first hour of life. It should be frequent, complete, unrestricted feeding, and exclusive breastfeeding, as I think Dr. Vidya Prabhakar has said in her talk. It should not be even water. Exclusive is only mother's milk, that is breast milk, not even water. So leave apart the other pacifiers and tits and the honey and all these things should never be given to the baby. Not even water till first 6 months of life, that is exclusive breastfeeding. The breastfeeding has to be continued for 2 years and beyond, with a complementary feeding from 6 months onwards. That too, a semi-solid, soft, hygienically prepared, homemade, nutritionally adequate preparation, that is complementary feed. I think that should be the appropriate or good breastfeeding recommendations with the perfect technique of breastfeeding. I think all of us take this initiative to make India, almost to achieve not only the SDG goal by WHO, which is only 50%, but as you all know, what I have come across over a few years working with this committee. I'm also obstetrician, mainly practicing high-risk obstetrics, like majority of you. But when I take up this committee, I found this very interesting. And then I just thought over, that every time we are talking about the benefits to the baby, benefits to mother, the family, and the country, we are talking of billions of rupees, which are going west over these baby foods and all these things. But still people are not, convinced, and not the breastfeeding rate is not improving. Why not to talk about what are the problems if the babies are not breastfed? More than, the sudden infant death syndrome, more than 50% of these babies, they develop infections, majority of them GI infections, respiratory infections, ENT infections, asthma, type 1 diabetes, obesity, even Hodgkin's lymphomas. So why not to, people are not convinced unless they are threatened. That is what we are understanding over the period of time. And this year we have a focus on explaining them what problems the baby faces if they are not breastfed. So let us hope that we succeed in this. And thank you, all the panelists.
Thank you.
Thank you, Madam first, Dr. T.V. Chitra, for making the expert comments. And thank you, all the panelists.
It's a pleasure, ma'am. And thank you for having given me this opportunity. And I would just like to, it was really a very interesting panel because you made it very short and stress on the very, very important points. Just 5 or 6 case discussion, everything came through excellently. So thanks a lot, madam. It was very wonderful. And thank all the panelists for all the inputs. We only not talked about lactation consultants because we're all very busy. So I think in our hospitals, we should have a person who's able to spend a lot of time with the person, especially when she's doing it for the first time. We just tell her, you feed, you hold the baby like this. We hardly spend 1 or 2 minutes, but it's only the lactation because I'm seeing it in our hospital. She comes and sits there for 1 hour also doesn't matter. She has nothing worrying. She has her whole time is dedicated, undivided attention to the patient. So she sits with her and then teaches her. So that really makes a lot of difference because we simply don't have the time, though we know. So we should either be willing to spend that much time or get somebody who's been able to do it. I think that,
Madam, I'm so thankful to you for bringing out this point because in some time earlier I have written a message that we as Fogsi Breast Committee has come up with a training module for nurses, which is Saheli, for which the academic content I have contributed. I have prepared the module myself. We have 2 modules, 1 hour each. And it has been, translated into 12 different languages. Thinking that obstetricians are the busiest one, even they want to, they can't give time. And these nurses are the ones who spend maximum time with the patient. So if we train them properly, they are the best counselors and they are with the patients in majority of the times. So we have come up with this training module, Saheli, for which Dr. Charmila has contributed in English and Dr. Ramani Devi has contributed in Tamil. Yes, Tamil. So I would request all of you to get your hospital nurses and paramedic staff trained by this module, because definitely it's going to help. It's whatever practical tips we have discussed, I have all done in that module. It's been all covered, so it will be very, very helpful, I'm sure. So I think you also can go through it and get your hospital staff trained. I think that's catch hold of any of the MQR person. He will happily arrange for all of you. May it be a government medical colleges or private individual nursing homes. So I think with this, I thank all of you and thank you for the opportunity. Thank you once again.
Thank you, madam. Thank you so much. Thank Chitra madam.
Comments from panelists.
Dr.
Thank you so much for giving us an opportunity to go through all the problems with the breastfeeding and all the common complaints we face with the day-to-day practice. So it was again catch up with the complications or the problems of the breastfeeding. Thanks for the opportunity.
Thank you, madam. We thank Nirmala madam, Dr. Saruna Kumar, Dr. Vanitha and Vijaya for the esteemed inputs in the panel. Thank you, madam. Over to Dr. Shanti Raniman for vote of thanks.
Madam, it's already getting late, but anyway, it's not fair to finish any forum without a thanking note. My sincere thanks to our Fogsi President Shanta Kumari Madam and Secretary General Madhuri Patel Madam for their gracious presence in spite of their busy schedule. I thank our Chief Guest, Dr. Jayam Kanan Madam, the past President, Vice President of Fogsi. It's always a pillar for this South Zone Fogsi people. And today's guest of honor, Archana Verma Madam, Vice President of Fogsi, and Charmila Madam. And my sincere thanks to Sneka ma'am for her passion towards the society she is holding. That is, as a chairperson of Breast Committee, she actually in this forum she showed her all her passion and the interest of making people attached to her committee, madam. much thankful for conducting such a webinar in South Zone involving all these societies. And thank you so much. And I thank today's speaker, Dr. Selvarani and Dr. Vidya Prabhagar, and the chairpersons, Dr. Amala Devi, Shiva Victor, and Chandrakala Mohan and Gayatri Nirgun. And again, I thank you for moderating this session in such a beautiful way, as everybody expressed their gratitude. And T. Vichitra Madam, who had given her expert comments in every cases. And I thank all the panelists, Manon Mani Ma'am, Nirmala, and Saravana Kumar sir, and Vanita and Vijaya. And I thank all the President and Secretary of Taini, Coimbatore, Salem, Dindukal, and Tirunelveli OBGYN societies for rendering their cooperation to conduct this in a very short time, and all the members who have logged in for this today's session. And not but least, I have to congratulate the convener of today's program, Manjula, was every day ringing up, and even at 9 o'clock, 10 o'clock, and she's asking about the schedule of the program, and was coordinated well and make this a great success. And I thank this Core Connect people, Mr. Abhishek, for making this platform very smoother one. Thank you one and all, and have a great day. Good night. Thank you, madam. Thank you, Snega, madam, once again. And
Thank you very much. And good night, all of
success
you.
in your future tenure. Thank you.
Thank you, madam.
Yeah.
Thank you so much. Thank you.
Happy Adiperku for tomorrow, all of you, with all variety rice and a good food day.
Thank you, madam.
Good night. Good night. All of you.
Good night, madam.
Good night.
Thank you, madam. Thank you, madam.
Thank you.
Thank you, Manjula, madam.
Thank you, Shanti, madam.